Lois and Rosalind to meet me there, and I've got here it's all boarded up.
Oh, it was like, Costa.
Pret, I think.
Pret, that's it. It's gone. Oh my God, it's been there years. That's where I always go.
Any more?
Well, when we were talking about, so this is the first time I've been here.
Oh, is it?
Yeah, Claire said to me, it's fine, you should go past Wicked, come out of Victoria, go past Wicked, and then, what she said, you'll find it, it'll be really, really simple. Okay. Yeah, it was quite strange.
When you've not been here before, though, you can come at this road like
Multiple ways.
yeah, and it confused me. I was going around in circles once, just like.
Yeah, if you come from that way, you're going to kind of struggle, but
Yeah.
I literally turned the corner, I was like, oh, okay, there we are.
There's loads, aren't there?
Yeah, we'll keep some for other events.
Hi, mister. You alright?
Yeah. Thank you. You?
Yeah. Had a great holiday.
Did you go away?
Yeah, I went to Italy.
Oh, okay.
Yeah. Some people said, you look really well. And I said, my tan though is fast fading here in the rain. But it was 42 degrees. So for Ryan, with not much of a colon left, it's quite difficult because he really dehydrates quickly. So yeah, it was 42 in Verona, almost 40 in Lake Garda. We were in Venice first, and we had a bit of hit and miss weather in Venice. The day we were leaving, it was getting so hot. The day before, it had rained like non-stop until about mid-afternoon. So yeah, it was just. But yeah, once we got to Verona, that was it. It was getting hotter and hotter. Lovely time, saw some nice places. But yeah, Ryan was like, shade. I need more shade.
Yeah, I'm not good with heat at all. I don't know.
I think Steve's put that in his slide deck as well.
Okay, that's good. And then the promoting NHS careers, I thought we could just do between us, but the key thing is it's not isn't it? So, yeah. And the thought we encourage people to be as interactive as possible. So you're worried it's not going to be anything.
So, what we put on here was the agenda. We put an hour in there to do roundtable conversations.
Yeah, which I think is good.
Thinking we were going to perhaps get people. So we haven't got innovation today.
Yeah.
Much to say. So when we put this together, the plan was perhaps 4 of the tables. So one of the workshops for each table, and people go to the one that they want to talk about.
Yeah.
For 20 minutes.
Yeah.
Swap.
And then
So swap them around once.
Oh, okay.
Do a little bit of feedback, and then into Steve.
Yeah.
My real worry is that not enough people can do it. like to do at least
One, two, hey, hey, one, two, check, check.
It's in the front and in the check.
One, two, check, check, hey, hey, one, two, check, check. One, two. Monday, Tuesday, Wednesday.
there was a bit of a mixed message going around because I don't know how far it went and actually whether I heard it drop. But they thought she was told.
One, two, check, check, hey, hey, one, two, check, check. One, two, hey, hey, Monday, Tuesday. One, two, check, check. One, two, check, check. Monday, Tuesday.
Yeah, I'm gonna have to be thinking, you know, in a very slow manner during the during the show. But yeah, so sounds good. I'm gonna be monitoring the feed, so I think I'm happy with the test.
knew the fund managers extremely well. One of them's like related to my best friend, so that was quite good. So we were all meetings. You know, you have to go and present a show. And he says, well, yes, hello, John. Yes, I'll get some tea. I said, thanks, come here. But yeah, the personal side was really interesting. But of course, they've got
1, 2, check, check. 1, 2, check, check. 1, 2. It's not coming out of the room now. It's not coming out of the room now. 1, 2, check, check. There it is. 1, 2, check, check. 1, 2, check, check. 1, 2, check, check. 1, 2, check, check. 1, 2. Mic 5, check, check. Mic 5. I'm not getting anything through either. 1, 2, check, check. 1, 2. Monday, Tuesday, Wednesday, Thursday, Friday, Monday, Tuesday, Monday, Tuesday, Wednesday, Thursday, Friday. 1, 2. Are you sending this to the stream? It's not coming through. 1, 2, check, check. 1, 2, lectern, lectern. 1, 2, check, check. 1, 2, check, check. 1, 2, check, check. 1, 2, check, check. Lectern, lectern. 1, 2.
I mean, I default, unfortunately, one year, because I've been doing this for 12 years. Yeah, it's I'm interested when I said someone asked me to look at property. So I'm huge, huge.
1, 2. Hey, hey. So I need to bring you higher on the level in the rooms
Yeah, to get through.
to get more, and then bring
your laptop, isn't it?
It is, yeah.
With this very
Mine-
odd.
very odd.
Is it going the wrong way? It's going the wrong way. It won't go the next way. Morning, everyone. Is everyone okay to start? Great. Can people hear me? Yes. No? Up. Is it? It must be working. Is it not working? It's not working. Hold on, AV guys on it. Thank you so much, Patrick.
That's better, see?
Maybe it's a Friday morning.
Oh, we never saw you on Friday.
Cheeky. Yeah, is that working? Great. Okay. Is that better? Yes, it is. Okay. So it's lovely to see everyone, and thank you to everyone that's coming in person. I know we're kind of live streaming as well, which is great. So it's been a long kind of awaited event. We've been wanting to do this for ages, so we're really excited to kind of get everyone together so we can kind of talk about what we've been doing in the last year. So we've got lots on today, which is great. So we've got a really packed agenda. So you're going to be hearing from myself and Stuart, just to give you a kind of highlighted update around what we've been doing this year. You're then going to be getting the work stream updates for everyone, which is brilliant. We've got a break, then some more work stream updates, then lunch, and then a round table exercise. So we want the event to be as it, like kind of everyone kind of coming forward with their ideas, saying actually what they're thinking we should be doing, if there's anything we're doing that we don't think is being effective, if there are more things we should be doing. We just want to hear people's ideas today, so make sure that, you know, you keep talking to us and you're telling us, and we've also got Slido that we're going to be using throughout the day as well. We've then got Steve, thank you very much Steve, for doing a national update for us, another break, and then our motivational speaker to end the day. So a good action-packed day. So, good to see everybody. So if we just go on then to kind of introduction. So everybody knows me, I think. So I'm Sheila Stenson. I am currently the Chief Finance and Resources Officer of Kenton Medway Social Care Partnership Trust, and also the chair of HFMA for KSS, and also chair of the Regional Finance Academy. Stuart.
And so most of you know me, so I'm Stuart Wayman, I'm head of the Academy. We've also got Lois, who's our new deputy, who's here. Liz, sadly, is sunning herself
In Venice.
Somewhere
Lucky
today.
her.
But most of you know Liz, she's been around a long time. And Rosalind is probably outside making sure that no stragglers get lost at the moment. So that's the team introductions.
So, support, do you want to do this bit?
Yeah, can I do this bit?
Yeah, of course.
So I thought it was really important to include this bit today. So what you all used to know as the old skills development is now a part of the academy.
I was just going to say, do you want it in?
Skills development now just a part of the academy, and we won't talk too much about what skills development does because the workstream lead is going to do that. But really, really important to make everybody understand that it's not just finance skills now. So I've heard Julian and Peter Ridley both say that other disciplines are really, really envious of what we've got in the world of skills development. So we've got the networks, we've got all the training, and it was kind of hard work, I think it's fair to say, to develop, as well as the finance skills development, a procurement skills development and a digital skills development. We struggled with what to call digital for a long time. We called it informatics and all sorts of stuff. We settled on digital. So the offering that everybody gets now is aimed at all of those people. The digital people are really, really keen to get on and do lots of exciting stuff. but it's the model that we use that everybody is actually quite envious of. So we're replicating that for the other disciplines. Procurement, we did add a little bit to our levy for. The digital, we're getting support from NHS England, Health Education England as was, to get it up and running. They supported other patches for 2 years. This is year 2 of our support. So they're keen that we make that one work as well. So there's no cost to the digital one. We've got lots of stuff going on in the digital space. I was going to say, any questions? That was just a, yeah.
So many of you would have seen me talk about this before. So this is how we're structured regionally for the Academy. So we've got 5 work streams. 3 of them are national work streams, which all of the regional academies are looking at. And then we've got our 2 local ones, that is ED&I and sustainability. So you're going to hear, and I'm not going to say much about them because you are going to hear about them throughout the day, which is great. But it's been a really successful first year, and I would say that people are going to say that I'm biased, but there's been lots of work, and I just want to say thank you at this moment, actually, because there's been lots of people that have come forward and said, actually, I want to be involved in this programme, and I want to kind of be leading work streams, or I want to be part of working groups. So I just want to say a massive thank you to everyone that's, is involved. We are always looking for more people to get involved. So please don't be shy. If there's anybody that's here today or anyone that's online that you want to kind of get involved in one of the work streams that you hear about, then just please either talk to myself, Stuart, or someone in the team. We're more than happy and always looking for willing volunteers. Anything else you want to say about that slide? No? Do you want to use this?
So we just thought we'd pop this one up as well. Pop this one up as well. So just really to make sure we're aware of the resources that we've got. So obviously we've got the Finance Academy. That's the one-stop site. So everything that we do, you will see on the Regional Finance Academy site, which is under the One NHS Finance. We've still got the Skills Development website, One NHS Finance, and we're doing all of this in partnership with HFMA and the Patch. So actually, one of the things I wanted to say is really good to see people from the further west part of the patch. So we've, as part of this, we merged South Central and South East Coast patches together. South Central used to have their skills development done by HFMA, so we're working with them as a partner to make it happen across the whole patch. We've got some really active social media going on. Lois is our social media queen. She's probably just gone out to tweet, I imagine. LinkedIn's getting loads and loads of hits.
It is.
And we're putting the newsletters out, so we've got the Regional Finance Academy newsletter and a whole bunch of resources there. So we'll talk a bit more about the supporting staff pack, skills development. There's personal portfolio stuff on there. HFMA membership, probably should mention at this point the free bands 2 to 6 membership. So I think as a patch, we don't think that as many of our bands 2 to 6 have taken up the free offer as could do. So there is a free offer there for people. They do have to sign up for it, and they do have to renew it when it gets to a year, otherwise it drops off. But other than that, it's free, and why wouldn't you take up the resource? We've got a staff induction new starter pack, which we'll talk about a bit later on, and coaching, I thought we'll talk about, I think, a bit later on.
So in terms of kind of celebrating our success that I've talked about, and Stuart, please do chip in here as well, there are a number of things I think that have gone really, really well this year. So we've got the council set up, which is what's overseeing the whole of the academy. So that's worked really, really well. It's got kind of strong leadership from the CFOs and deputies and others that are involved in it. So we've been meeting routinely now for well over a year, actually, which is great. And we've got a really clear kind of programme that you've just kind of seen me talk about. So the other thing that I think is really, really positive, and I'm looking at Leigh now, is we've got an ED&I strategy. So Natasha, I know you're in the audience as well. You've done lots of work on that, and that's been really positive. It was signed off by the council, and we are working towards that, which is great. There's a lot of work that's gone into a survey, which I'm sure will be touched on when you get the ED&I workstream update a little bit later. We've got a really clear communication strategy, which is what Stuart's just talked about. So it was about how do we get the message out about the academy. And yes, Lois is now back in the room, but she's done so much work on kind of social media. And I was really impressed with the number of LinkedIn people that we've got following actually the Regional Academy now, which is great because she's posting lots around what we're doing, which is fantastic. So thank you, Lois. And Stuart's touched on the website as well. So Camilla and the team from One NHS Finance have helped us set up the South East Regional Finance Academy website, there is everything on there. If you want to know anything about what's happening, it's got links to loads of different other websites. It's got kind of videos on there of things that we've done in the past. If people want to know about kind of, you know, accreditation, for example, and what that means for getting your team accredited. So there's lots that's on there, so please do use that actively. And as I said earlier, just a massive thank you to everyone, because there's lots of people that are involved in the separate work streams. Anything you want to say?
I think for me the key thing in this is that middle box. So we've got some really strong support at senior level. So, you know, this is gaining traction now in the patch, so that's really good. Sustainability didn't really talk about, so
Because I know Shona's going to talk
Shona's
about it a
gonna
little
do
bit
that one.
later.
But that's another one that's really, really racing away. They're putting loads of stuff up on various places, sharing case studies, that kind of stuff. And you touched on the social media, so not strangely, the digital people seem to be engaging really well through social media
Yeah.
rather than
We'd be worried if they
necessarily-
weren't.
Well, no, but so
Screens not people, but
so we're running a similar sort of event to this for your digital people. 27, 30 people already booked in, and most of those came through Twitter and LinkedIn, really. So that's it's quite good to see.
It's really good seeing. I would say we can't underplay, because actually the digital has not been part of our agenda for that long, and actually they've come together, and I know, Lois, you've been kind of leading that, so thank you. They've come together really quickly and have kind of got engaged and want to work as a kind of digital community, so that's really, really positive. So we talked about kind of some of the resources we've launched recently. So shall I just touch on the finance staff induction pack? And so that came out of the council meeting, and actually some of the CFOs were saying, what is it you could provide us with, Sheila and Stuart, that would say what the academy is about? And it's for new starters, but actually I think, and I know Lois has been heavily involved in pulling the pack together with the One NHS finance team, it's probably useful for all of our staff, because it was aimed at new starters, as I said, but actually it just tells everybody what's involved in the academy, where you can go to for certain things, so for skills development, talks about the HFMA band 2 to 6 membership. There's just lots and lots of information in there. So if you haven't seen it already, I am sure Stuart or Lois will be able to get it out to people that want to see it, especially people that are in the room today. We can email it to you. Anyone that's online, just ask and we can get it out to you as well. But it's probably been published about, I would say, 2 months ago now. But yeah, it's a great pack. It completely says what we're doing in the academy, and it kind of just everything that's happening in the finance world from a kind of staff development point of view. So really positive. Do you want to talk about the coaching offer, which is new with HFMA?
Coaching, before I do coaching, there's still a lot of confusion everywhere, I think. It's not just this patch about, you know, who does what. So what's One NHS Finance, what's HFMA, where's skills development, all sit in this. Hopefully the answers are pretty much all in there. But the answers, well, you'll hear the answers loads of times today. So it's a One NHS Finance overarching umbrella that supports all of those things. But hopefully that's clear in the pack. Coaching offer. So this is new for us, and this is part of our partnership with HFMA. So we have agreed with HFMA that they will provide a number of coaching places for people in the patch as part of the your membership of the academy. I think we've agreed 35 places. We're going to do it largely on a first come first served basis. We'll review and see how that's going, and that's something like up to 6 coaching sessions that individuals can sign up to. That's probably it, I think.
Okay. Do you want to talk about talent management strategy?
So talent management strategy, I'll do this. So this is brand new, hot off the presses. This was launched last week at the One NHS Finance Summit, which I was lucky enough to go to. So One NHS Finance has been working on this for quite some time. So they've launched the pack. I think there's another slide with some of the resources. So these are the toolkits that live within the strategy. So a self-assessment toolkit. A lot of this is about having conversations that are not necessarily part of people's appraisals, but identifying talent and, you know, working with individuals to get the best out of them. Probably that's what I want to say.
Do you want to talk about this?
Yeah. So I think Steve's got this in his slide deck as well. So actually, this is really important, this one. So you will probably, hopefully remember that about a year ago, One NHS Finance did this big one conversation where they asked everybody what it was that they wanted. That drove everything that we've got to so far, and they've decided that now is the time to refresh that. So they launched this again last week at the Finance Summit. So an opportunity for everybody to get involved, have their say, tell us what they would like out of staff development, supported by the FLC, so the Finance Leadership Council, which is chaired by Julie, and Deputy is Peter Ridley. So an indication of how seriously people at the top take all of this. That's it, I think.
Should we leave that slide and let Steve do the talk? Yep, he's giving me a thumbs up. Perfect. Did you want to talk about this?
Yeah, I'll do this one. So, really like this slide. What this shows you is pretty much the top lines are the levels of accreditation, so level 1, 2 and 3, and the bottom line is the staff satisfaction survey scores. And so really, really pleased to see that there's an obvious link between all of those things and the accreditation. So we've been saying for a long time that accreditation is a really good process to go through. It's really good for building your team and getting everybody engaged. And this kind of backs it up. This one here is the one that worries me most of all. That's the "we are always learning" question. There's two elements to that. It's about appraisals and it's about staff development. We do, although it's the worst on here, we, as finance, we do quite well on this, but it's one that we need to do a bit better on. I think it feels a little bit like we do appraisals perhaps as a bit of a tick box, we don't do them very well. One of the things we're trying to do is to train people to be appraised as well. So what am I going to get out of my appraisal, rather than I've got to go along and do my appraisal and it doesn't really mean very much, and then I don't get the development that goes with it. So we're trying to boost that one. But the point of this slide is that the accreditation is a good process to go through, and it kind of reflects in there. And as you get, I guess as you get further up these levels of accreditation, you've got better senior buy-in in your organisation, and that seems to flow down to people feeling valued.
It's very interesting though that on the "we are always learning," it does literally go like level 3 at the top. There's no overlap, is it?
No.
Depending on the level of accreditation is how that slide falls. Anything else you want to say on that? No? I think Stuart's point though about kind of appraisals, it's going to be, isn't it, going forward as a community, how do we link appraisals a lot better, I would say, to the development conversation? So, and I'm not saying that we're doing it as a tick box exercise, but I do think it's about how do we get more out of that development conversation with our staff going forward.
And that kind of links into the talent management.
Yeah. So, promoting NHS careers in the South East. So there's been lots that's been happening about this in the kind of like National Finance Academy, but Lois and Stuart are really pushing forward now in what we do in the South East, and I think this is going to be really, really exciting. So we all know the NHS does kind of a lot of staff career opportunities, but often we don't focus on finance, or we don't focus on the support services functions. So what Stuart, Lois and I are really keen to do, and have been talking to the council about, and they are fully supportive, is how do we get into schools, how do we get into colleges, how do we get into universities? So we are working on a programme at the moment that we can start to tackle that, and I've been meeting with some, in my local patch, some of the chief operating officers of some of the schools, really just start to say, how do we have this conversation with you? Because they're used to having the conversation with the NHS about anything that isn't finance or any support service, really. They're used to talking to us about nurses, doctors and things like that, but they're not used to talking to us about why people would want to come and work in NHS finance. So that is something that we are keen to be doing. This is the time frame that we're working to, and it's been signed off by the council that oversees the whole of everything we're doing around the academy. So at the moment we're drafting the strategy. We're probably slightly a little bit further behind than where we wanted to, but our aim is to get that done over the summer period. So come September time we can really start commencing kind of formal conversations with the schools and colleges, because what we need is a programme to say this is what we're going to offer you. So they were really clear, and I met with some of the leads, that actually they want us to be saying this is what NHS Finance can do for you, and this is why you should consider an NHS Finance career. So that's what we're putting in. So actually there's lots that's been done kind of by the national team, but we really need to make it bespoke to the South East, kind of what's different, and there will be things that are different about us, so you know what's that sells, so that's the key piece of work that we're working on, and I think will be a massive kind of part, and it's going to take a lot of effort from all of us involved in the academy to get this right and to get it up and running. But an exciting piece of work to be doing. So if people here today or anyone online wants to be involved, then please just let us know, because we are looking for volunteers, because we're going to want people to be going out to schools, universities, talking to kind of students to really encourage them. Anything you want to add?
The only thing I would add is there's probably some of this going on around the patch that we just don't know about.
Yeah.
So
Yeah.
if you are doing some of it and you want to talk to it, Lois is kind of leading on this one. It would be really good. As Sheila says, it's a huge piece of work. So we kind of started down here where we really want to be hitting and work backwards from that. At the moment, we're trying to get contacts and links into. I have no idea how many schools and colleges in the patch. It feels like a mammoth task. It probably feels more mammoth to Lois and Liz, who are doing most of the contacting people. But it's almost as if we have to. We're struggling to find a central point, so we're having to go out to lots and lots of places. So if anybody's already doing a bit of it and or wants some of it, there's the nods going on there, so it looks good like that. And we'd like to do it sort of cohesively and well across the patch, so yeah, get involved if you can.
So I think Stuart's made a good point. We do know there's bits that is going off across the patch, just to say, and it is informal, and this is about our opportunity to formalise it, because actually, which is why I'm saying to Lois, let's take time to get this right. We might be a little bit behind, but I'd sooner get it right, because it's going to be the formal offer, and it's what it's going to look like, isn't it, for us as the kind of NHS finance community to the South East. So it's important, it looks professional, and you know, NHS finance will obviously help us with that as well. But as Stuart said, we're learning lots about the education sector and how actually the schools have come together. They've formed academies. It's just changed so much in the last few years. So it's going to be really important we pitch it right. So that takes us on to the workstream updates. So does anyone have any questions in particular that's in the room? And I can't see if anything's on Slido because I left my phone on the desk. So, but I will get that once we kind of are in the breaks. But shall we move to the workstream update? So Hannah, I think you're first. So let's welcome Hannah up, who's going to talk to us about FFF.
Buttons on this are a little bit counterintuitive. I think that's the one that moves it forward.
Yeah.
It's the bottom one. There you
Okay,
go.
bottom one. Okay. Right. Hi everyone. Can you hear me all right? Good. That's me. Okay. Those of you that don't know me, I'm Hannah Ferris, Deputy Director of Finance at Maidstone and Tunbridge Wells Trust in Kent. Before I go into it, just be good to know people in the room, and apologies, I don't think I can see people online. I just wanted to get a sort of, I guess, a feel for in the room where we are in terms of some of the things I'm about to talk about. So who here knows if their organisation has an accreditation already that Sheila was talking about? Just to show our hands. So about half the room, okay? I've got some of my own staff, so it's like a test. Have we got any value makers? Any value makers in the room? Lots of value makers. Have we got any faces? A couple of faces. Have we got any health and wellbeing champions? Oh, brilliant. Okay. If you don't know what any of that means, hopefully you'll have a bit more of an understanding in about 10 minutes. So I will jump over this slide because I think Sheila's just explained all really well the different bits, but Future Focus Finance is sort of part of the slots between the Innovation Forum and the Finance Academy. And you saw this slide earlier, so I'm just concentrating on the left-hand, right-hand work stream, which way you look at it, the Future Focus Finance work stream, and you'll hear around the rest from our colleagues in a minute. So, what is FFF? So it's all around supporting our staff, promoting NHS finance careers, demystifying NHS finance, both to ourselves and our non-finance colleagues who always think it's all smoke and mirrors. Developing our finance networks. There are many networks, and I've just heard about some more just now. So there are many networks. It's just a way of connecting people that have got the same interests, both regionally and nationally, and obviously the ability to do teams and things has really opened up recently to really do those networks in a bit more of an efficient way sometimes, and around the thank you campaign. These are just some links of some of the things you can find on the Future Focus Finance website, but it's a wealth of resource and information. And I was going to mention the national conversation, but we've already mentioned it, so I'll just remind you then. So we've got 6 objectives for our work stream, so it's quite a broad work stream. The first objective was to improve communication, collaboration and sharing of information among clinical and other non-finance colleagues. And really that's probably quite recognised in the role of the value maker and how we increase the number of value makers and people wanting to share their information. The second objective is to increase the number of organisation accreditations. So how many across the South East have got their accreditations. The objective 3 is to improve flexible working and to promote a work-life balance for finance staff. We often hear in staff survey work-life balance, long hours of finance staff. How do we manage that better? And also with the changes to hybrid working, how do we make sure that works for our staff? Objective 4 is to improve the well-being of our staff, which again, quite a new, I think 10 years ago, well-being wasn't something we really talked about, really big on the agenda now and really important, and recognising if we look after our staff, surprisingly, they do better at their jobs as well. Objective 5, increase the number of applicants within NHS finance departments, very much alludes to the work Lois has been doing around interacting with schools, trying to get more people interested in working with finance. We're actually quite lucky where I am at the moment. Our recruitment's pretty good. We don't have lots of vacancies, but I know in other areas we're struggling to get people interested and thinking that it's a career for them. So how do we improve that? And the last objective is to improve training and development opportunities for finance staff. There's loads out there. It's knowing where to look and how to network and signpost people to the right roles. And I think there's probably pockets of people that there's people that access the training really well, and there'll be people that don't know it's there, don't feel they can have time off work because they're really busy. So that's how do we improve all of that. So a little bit about accreditation. As we saw the graph that shows the benefits of it. So just to tell you a little bit more about the process. So it's a process designed to allow recognition to organisations that have the best finance skills development culture and practices in place. And it is that culture bit about how do you make sure you're always learning, always improving, always developing. How do you get that culture right at your organisation? There's 3 different levels, and it's around continuous development. So you'll see the 3 levels sort of build on each other. The first level is a self-assessment. So you go through the checklist, you say whether you think you meet it, and then you submit. The second one is assessor-led, so you have to submit some evidence to demonstrate you think you meet the competencies. And then the third one is more of an involved and interactive, interviews with staff, understanding, almost a bit like CQC do, if anyone's been involved in that, but almost going to the organisation and speaking to them and go, does this really happen? Hannah said you all do appraisals like this, but what does it feel like to staff? The assessment process, you can apply 3 times a year. So the next deadline is August, and then December and April. I would warn you though, if anyone is looking at their level 2, you do need to let them know 6 months in advance, because they need assessors obviously to carry out for level 2 and 3. So if anyone particularly, and lastly it does expire, so it only lasts 3 years. So if anyone's about to expire and you haven't already made contact, you probably do need to look at that to make sure you don't run out of time. Level 1 is not the same, so if you want to just apply and you've not been involved at all, go for level 1, that's fine. But yeah, you just need to plan. It will probably take 6 months. It's not a quick, there's quite a lot to gather. There might, amazing if you go through it all and you can do everything straight away, that would be great. But there's bound to be a few things that you're like, oh, we don't actually do that, let's implement it. So that gives you time to do that. And yeah, the benefits Sheila's slides, I think, really clearly demonstrate. And that's the first time we've sort of been able to get that data, which is really helpful to show the differences that having the accreditation has. Moving on to the different networks I was talking about. So there's others, and I think my colleagues will pick up other networks and champions. So these are the 3 we're kind of concentrating on. So we've got Value Makers. Value Makers have been around a while, so a lot of people have heard of them. But it's a network of passionate finance professionals that champion One NHS Finance within their teams, organisations and health communities. Then we've got finance and clinical educators, or FACE as they're often known, and these are people that really champion the clinical engagement and the training of people to improve patient outcomes, so they're proactively providing a form of training to people. And then we've got health and wellbeing champions, and good to see we've got a few in the room, but it's a relatively new role, and as you'll see later when I show you some figures, we've not got enough health and wellbeing champions registered. That doesn't mean we're not doing health and wellbeing, but we're not seeing that come through. And they really work to improve physical and mental wellbeing of finance staff, both raising an awareness of issues and signposting support. So how are we doing now? I don't know how easy these numbers will be. I know we all like numbers. So we're the orange column, which doesn't show at all on my black and white printout, which is good. So of our 37 organisations across the whole of the South East, we've got 21 have got an accreditation of some form. So, and where are we in the patch? We're about, I think we're middle. So you've got North West and London kind of striding ahead with quite a strong number of people that are accredited, but there are others with lot lower numbers of accreditation. We've got good numbers of value makers and finance and clinical educators, lower on the health and wellbeing champion, but lots are lower on that as it's a relatively newer statistic. If you want the detail on your organisation, I do have them if you want to come and see me later, but it's a really big slide if I put everyone up, and you'll never read it. But here's just a little, because we like a graph as well, here's a little snapshot across how we do as a system. So the national position is at the top, so this is proportional, so there's a different number of organisations in each ICS system. So across the South East, about half of us, the blue line means you haven't got any accreditation. The bronzy colour is level 1, grey or silver level 2, and the gold is level 3. So we only actually have one organisation who's in Sussex ICS that's got level 3. And interestingly, actually, the rest of that system don't have any accreditations. There's a bit of a gap there. And then Kent and Medway, everyone has at least level 1 accreditation, but that's the only system where we've got everyone with an accreditation, and the rest are in the middle with around a third of them accredited. So we've got a bit of work to do on getting everyone up to level 1. And then in terms of network individuals, so that slide I showed you the total number of value makers, FACE and health and wellbeing champions, but I wanted to look at how many organisations have one of these, because actually it's no good if all the value makers are at my trust. It doesn't, I need to know they're everywhere. So unsurprisingly, value makers, 93% coverage. It'd be great to have 100%, but that's probably not surprising. And FACE, 76%. Health and wellbeing is only at 32, although that's quite an improvement, Stuart, isn't it, from when we first looked at this? So we're gaining momentum, but it'd be really good if everyone, and probably people now have them. So we actually had one internally for our health and wellbeing, but we hadn't sort of set them up. They're now set up and attending the conferences and things as well. And I've shared the accredited bits there. So how do you get involved? So these are, I guess there's some things you can go away as individuals to support this, but I'm also looking to set up some working groups, because there's some quite big themes here around accreditation, but also health and wellbeing and flexible working. So that if you're only interested in one of those, that's fine. Happy to have people engaged in different ways. So there's things you can do around promoting engagement, so just going back and saying to everyone, there's all these roles and networks you can be involved in, suggesting to other people. It's not really ideal if one person is the value maker, the FACE and the health and wellbeing champion. Try and spread it around. Working with your organisation or your local organisations to secure accreditation. Working in partnership with stakeholders to ensure we really look at the benefits of hybrid working and how it's working. Engaging with CFOs, deputy CFOs and stakeholders to look at the programme structure and really understand we're considering health and wellbeing whenever we're implementing or making changes. Identify NHS professionals to aid the promotion of careers in NHS finance. So I'm sure Laius is looking for some support in how do we how do we engage? And that might be an example of where you could share best practice. So you might say, actually, we work really well with our local school, and this is how we do it. It'd be really good to hear some stories of where people have already done it before. And then finally, yeah, just working internally and externally with stakeholders to build best practice around training and development. There's a lot of, let's not reinvent the wheel. If you've already got a good way to deliver budget holder training, for example, is it something we can replicate so people don't need to redo it all? So I think we've got the session later on the workshops, haven't we? So if people have got questions, I'm happy to take any now. But if there's things you want to know a bit more about, come and see me then. Any questions? No?
No questions. I've got a couple of comments.
Don't question me.
What people think of questions, really.
Comments with a question mark at the end.
Just a reminder, there is the Slido thing if you want to ask questions through Slido. I kind of understand this, but I think Hannah did a really good job there of clarifying it. I didn't hear you say, although it was kind of implicit, the aspiration is we have 100% organisations with some level of accreditation. You mentioned the assessors. The other tip that I would offer up is the accreditations require that you've got your professional body accreditation for staff. That you need to have an accreditation with everybody that you have staff working with. They're sometimes a bit of a hold-up. So if you're looking to do an accreditation, I would say get the professional bit in the bag as soon as you can. I've seen some of the accreditations go through the FLC subject to. I know there was a delay, for example, in getting CIPFA accreditations through. So I know of an organisation that had everything in place apart from their CIPFA accreditation. I think they appear on one of our charts as a red one, so they kind of got it, but they need the CIPFA thing. And the health and wellbeing one, numbers picked up a lot. But I can't often get told we've got health and wellbeing people in our organisation doing health and wellbeing our organisational way. And my kind of take on that is, yes, you probably have, and that's great, but you're missing out on the whole network. If, why don't you get those people involved in the network, and then they can get access to the resources that go with being part of the network.
Thank you. Yeah, just to add to about the assessment, the criteria is changing from December, and one of the things I think it adds in is around obviously the assessors are people that already work in the NHS, and you need to have an assessor trained, able to do assessments for other people, which will obviously slow the logjam of everyone needing an assessor. But that's probably another thing to think about quite soon. There are some courses in September if people are interested in being assessors. I don't know how long it takes to get through being an approved assessor, but that will be something to start thinking about as well. Thank you.
Thank you, Hannah. Could I just ask you to thank Hannah in the usual way? So, we've got Sharon here doing the sustainability.
Good morning, everybody. For those of you who don't know me, I'm Shona Metcalf. I am the Deputy CFO at Kent and Medway ICB, and we've been doing some great work, I think it's great work anyway, in the South East on environmental sustainability. I'm going to talk you through a bit about the national context and why we're doing this, a bit about why finance professionals are so important to this work, and what we're doing in the South East. So a bit about the national context and why sustainability matters. Now, there's a huge amount about this in the news. For me personally, I think it's something I'm really, really passionate about. And I think there's a moral imperative to do a lot of work in reducing our carbon emissions and working on climate change. But there's also a legal imperative to do this as well. So it's enshrined in the Health and Social Care Act that we've got a legal requirement to get to net zero. So in the NHS, we have set up to get to net zero by 2040 for the emissions that we control. And that's not a backloaded target. We're looking to do 80% of that in the first 10 years, which is a huge undertaking. and we're being more ambitious than the private sector in how we classify the emissions that we control versus what is in the supply chain effect. And we've already made some really great progress in the NHS. In the first year since making the commitment at COP26, we reduced emissions equivalent to powering all the homes in Birmingham. We launched the first net zero emission ambulance at COP26, first healthcare system in the world to do that. We were the first healthcare system in the world to commit to net zero, which is a huge achievement. And at least 20 have followed us since then, some including Norway, Malawi, but we've got a lot of others that need to come with us as well, including the likes of Germany, United States. So we are, another way to put it, we are world leading in this. We really are setting an example. The NHS covers about 4% of the UK's emissions, so we've got a big scope to have a huge impact here. And I think one of the really exciting things for me on this, I often feel quite powerless in what we can do on reducing emissions and getting to net zero, is the power of the NHS in terms of our buying power. We spend about £150 billion a year, and when you spend that kind of money, your suppliers listen to you. So when we signed up to net zero, 10 of our biggest suppliers made the same commitment. That includes Apple, Microsoft, Johnson & Johnson. So what we're doing in the NHS is having an impact beyond the NHS borders and also beyond the UK's borders as well. So we're having an impact on what's happening globally. And I think that's really, really exciting. So in terms of where our emissions come from in the NHS, when we talk about scope of emissions, the scope 1 is the ones that we're directly emitting ourselves. So that's in our context, it's burning fossil fuels on site, but a lot of it comes from things like anaesthetic gases as well, which is something you tend not to think about. So nitrous oxide is a big one, desflurane, which is an anaesthetic gas. Standard canister of that has the same impact as burning half a tonne of coal. It's just some of these things that we're doing a lot of really great work on, and we've got a commitment to phase that out completely. Scope 2 is indirect, so that's usually electricity, and then scope 3. In the NHS, we've been quite unusual in thinking about bringing in some of our scope 3 emissions into what we consider that we control, and I think that reflects some of the buying power that we've got, which is really exciting. One of the examples there is metered dose inhalers. These are the standard asthma inhalers, the blue and brown ones a lot of people know. Those have a really bad carbon footprint. It's really, really bad. But we can often move patients very easily to dry powder inhalers. Tend to find that that's clinically appropriate. You often get better disease control with that. Patients like it better. It's appropriate for about 90% of patients, and there's a financial saving that comes with that as well. So this doesn't all need investment. Some of it will, but there's lots of savings that we can get through this work as well. Okay. So this is the bit that some accountants get really excited about and some get less excited about. With sustainability reporting, there's a lot that's happening on this, and when boards internationally, and this is not just the public sector, started looking at what we need to do on this, everybody looked to the accountants because we've got such a great reputation for doing really good reporting. So the IFRS Foundation, I'm sure you know and love a lot of their work, have set up the International Sustainability Standards Board. And where they're really prolific in issuing accounting standards, they're equally going to be expected to be prolific on the sustainability as well. They've already started issuing the exposure drafts. So we expect that in the same way as the IFRS accounting standards are adapted through FRAB, we're going to have a similar adaptation in the public sector. So there will be requirements to do reporting, and we'll look to accountants to set the standards. I'm sure a lot of accountants will be involved in the reporting when that work happens. So we're probably looking at the next couple of years before we start to see that coming in. Most of the work in the NHS has been on net zero, but the work of the Standards Board is on wider sustainability and quite possibly governance. It's going to have a wider reach than what's just in our green plans at the moment. So that's something to watch for. And where the accounting standards come out, the auditors soon follow. So I think there's going to be a lot of interest in that space as well. So a lot of people get excited about that. I hope there are some people in that room. So the question really then comes to why do finance professionals need to get involved in this? So the previous slide, I talked about the respect that we have as a finance community internationally. I think that's one of the reasons we need to get involved in it. I think our boards and organisations are going to be looking to our specific skill set to support with this work. There are going to be costs to implementing some of the changes, but there's also financial savings, and I think that lens is really, really important. And Hannah and others talked about the amazing networks that we've got set up across the South East and across the finance community in the NHS, and I think those networks are a really important part of this, and we can leverage those to make some really positive changes. Oh, wrong side. Okay. So what we're doing in the South East, in summer 22, we set up the sustainability work stream. We're the only regional academy that has a sustainability work stream. And it's led by Jason Dorset, who's the CFO at Oxford University Hospitals. And I've been working with Jason on this. We've got a network of mainly CFOs, but it's not just CFOs. We welcome all grades coming into the network, who basically people who are really passionate about this in the finance community, looking for opportunities for how we can advance this agenda. We're working on setting up a network of friends, of people who want to know what's happening, are a bit interested, but a little bit less committed to getting involved, not sure where they want to focus their efforts at this point, but want to learn a bit more. And we have focused on three main things. We're looking at getting visibility and engagement across local systems and delivering green plans, championing cost savings that have a sustainability lens on them, and cost neutral projects, and helping resolve challenges and being a bit of a test bed to work on problems. Okay. Talked a bit about those objectives. So the first one is looking at business cases and how we can access funding. There is some funding available. I'll give you some of the examples later on, but really trying to share the experience that different people have had on getting access to specific bits of funding and building in best practice into how people build business cases and get them through the approval process. Looking at sharing good practice, so we've got a range of opportunities that we've identified in case studies, so trying to get those shared. The team that are highlighted there are from Charing Cross Hospital, and they saved about £125,000 on an annual basis on a specific project reducing cannulation in their emergency department. So they found about 86% of patients were cannulated when they arrived in their ED. It's a bit painful, it's got risks attached to it. It's not a brilliantly pleasant process. They found that they didn't need the majority of those cannulas, they just weren't used. So they did a project to reduce that, saved £125,000 and saved, I think it was about 24 tonnes of CO2. So it's one of those things where you've got opportunities that have a financial benefit, clinical benefit, and environmental benefit as well. So we're doing a lot of work on increasing engagement and understanding, done lots of presentations, and we've also been engaging in the tertiary education sector as well. So I've got examples there. So things that we're thinking about doing over the next year, this is an evolving piece of work. We're looking at inviting specific organisations to come and showcase their work. So we're working with Johnson & Johnson and a waste partnership in Northumbria, who've been doing some really great work on reducing, improving the way that hospital waste is managed. We're developing the sharing of best practice and reporting, so helping kind of share the ideas and case studies across the system, and also strengthening the comms and engagement. And we've got some more capacity from the academy team, which has been fantastic and really helping with that. But we're always looking for new people to get involved in the work and support us. So a little bit about the funding that's available. The main one here is the Public Sector Decarbonisation Scheme. It's around about £500 million of funding. When the last phase went live on this, it was oversubscribed more quickly than Taylor Swift's recent tour dates. So you need to get prepared for this, and I think this is really key. So we're trying to make sure everyone's aware of what's coming. And is learning from other people's experience of doing previous bids for this work, because we know that depending on which route of funding, some of the organisations and groups and awarding bodies have very specific requirements and nuances, and if we can share intelligence on that, that's really going to help us. On the first one, the big one, the PSDS, the NHS has been more successful proportionally than any other public sector body. So that's really exciting. We want to kind of carry on with that. So very briefly on my personal experience, and this is just a bit of a plug to try and get people involved. I found it a really positive experience, and it's about doing some of the things in the NHS that have a wider impact. It's sometimes hard to see what we do and how that impacts on patients, but there's about 40,000 deaths every year that are directly related to air pollution, which is really scary. And that's just the direct deaths. It gives you some indication about the impact on comorbidities, and there's links with air pollution to autism, COPD, asthma, and it affects our deprived communities disproportionately. So it's got a health inequalities impact as well. And I think the evidence, if you just look at the news at the moment about what's happening, there's really big evidence about A&E admissions. There were 3,000 excess deaths last summer due to the heat wave. So this is having an impact now, and it's going to become more and more significant. So it's an opportunity to have an impact directly on things that are having, working for patients. There's something about getting permission to get involved in this type of thing. And for me, it was about setting a personal stretch target to do something above and beyond. It's been great for getting non-finance experience and learning a bit more about other things that are happening in the NHS, and getting support and mentorship, but providing that support and mentorship as well. I think this is something where we are shaping national policy, but also international policy. So I've done some work with the ACCA and IPSA, and was on a working group with colleagues, and I feel like they're colleagues now, from lots of different countries, so Korea, Canada, Germany, South Africa, and that was a really exciting piece of work, seeing that we are leading the field in many respects in the NHS, but learning about what other people are doing internationally as well. So it's been a really positive experience, and if I can encourage people to get involved, that would be fantastic. So very happy to take some questions.
Thank you, Shana. Still got no Slido questions. I've put a little note on each table, but the
I was going to say, how do we get on Slido?
We'll put something up in the ad break.
there is a QR code as well, which we'll share with you, but it's Southeast
That's for
Academy.
the kids, Stuart, but you know. How do we get on?
Are we not down with the kids?
No, we are not.
So it's Southeast Academy 1 year on. Patrick's got a question.
Oh, no.
Fantastic.
Thank God he's got the microphone. When do you think we ban car parking?
Having worked in region as well, I think there's not many things that are much more contentious than car parking. Whether it's, and also looking at the COVID bit with whether it's free or not, it's really, really contentious. I think personally, and this is my personal view, is we need to win hearts and minds on this and change behaviours. So it's about things like EVs are going to be part of the response, so it's not always going to work. There's been some great examples of organisations restricting the types of vehicles that people can buy through Fleet Solutions, which is really good. There's more electric options coming through Fleet Solutions, but it's also about organisations, and this is individual providers, working with local government example on public transport options around hospitals, because it's not just about, it's about patients as well, and it's not going to work for everybody. It's kind of, I think it's a bit of a nudge both ways. We can make it a little bit more difficult, but we're trying to make the alternatives much easier and better known for people as well. We're trying to do the softly, and then
Do you think softly will work? I asked that on the morning after somehow the Tories managed to hold Uxbridge based on, ULEZ.
Yeah.
I just worry that Hearts and Minds doesn't work and won't work quickly enough.
Yeah.
So, and I do wonder whether that encapsulates, I think on one of the slides we have staff transport as an indirect rather than absolutely direct. You know,
Yeah.
they're coming in to work for us, therefore what do we do? You know, do we start with the, if you live within 3 miles, no car parking?
Yeah. I'll leave my politics aside for this. But no,
Go with your
yeah. But we are working really hard on this, and I think it's about making the alternatives workable and feasible for people. And we need to think as well about staff who are coming in and doing quite unusual shift patterns, and that is a factor in it as well. So we're focusing on making it more possible to use the sustainable options. And I think it's a balance of thinking about what can we do right now, what's within our gift to do, and working with the national team as well on what the NHS policy is as well. So there's a bit of, I think, trying to focus more on what we can do is within our gift. If you're feeling brave though, I'm very happy to work with you on a case study and let us know how you get on.
It's one of the things that unites both the Joint Consultant Committee and the JCF, that as soon as the accountant says we want to put the price up for car parking and ban it, then you become a figure of hate, and they just dismiss the cost improvement target willy-nilly.
We do have another question.
Hi Shona, I deal with capital business cases, and often one of the investment objectives we see is one around NZC and reducing net zero. Do you think this is an area where we can also develop metrics and measures, including reducing the embodied carbon targets?
Yeah. I think it is, and I think it's going to be a really critical part of it. We're doing some work on trying to support best practice in business cases, but I know that there's requirements in terms of the net zero considerations in business cases. I think with capital, there is a point about considering the carbon benefits and impact of a specific option that we're looking at, but we're also going to need to think about mitigations and responding to the impact of what will be happening. So buildings are going to need to be, and it's not just buildings, our whole estate is going to need to become more resilient to increasing temperatures. We're also going to have higher flood risk as well, which is going to have an impact. We know there's hospitals in the southeast that have got significant problems in the next 20 years with that problem alone. And there was an example last summer, I can't remember which, one of the London providers had very significant IT outages due to the temperatures. So there's a big piece about resilience, and I think we're going to need to consider that very carefully when we're looking at business cases.
So, first Slido questions have arrived. So the first question is, I work in an acute provider. What is one example that we can take back to our clinical teams to implement?
I would say the metered dose inhalers and dry powder inhalers. That's got a cost saving and a clinical benefits for patients. I'm going to slip another one in there as well. The anaesthetic gases on desflurane, the Royal College of Anaesthetists has come out in support of that. So when you've got the clinical support behind it as well, those are really good ones to go at. And a final plug on this as well, the 90% of NHS staff support the Green Plan. So if you can find something that's got a financial saving, and we'll share ideas on this, that's also got a carbon benefit, go with the carbon benefit, because we all know everybody's really, really tired, and an accountant's coming in and saying, can you save some money? It doesn't always get the best reaction, but if you're saying, can we help save the planet and improve the experience for patients, you're hopefully going to get a much better response.
Then I have one other. I don't quite understand this. I hope you're good on it. So the question is, how will nitrous oxide be replaced for women in labour?
So there are other pain relief options. So I think there is something about informing and educating patients, but it's not just about replacing it. That would be a clinical decision. There are options about recapture. So there's systems to recapture nitrous oxide, which dramatically reduces the impact. It's quite complexities around whether it needs to be built into the infrastructure of the hospital and was quite difficult, but there are mobile units to do recapture, so that is an option. So we don't have to take it off the table.
Does it work?
The recapture, yeah.
No, gas and air. It's come out from the birth experience. I can't go for gas and air. Except for the husband going, I wish I had gas.
Okay. Any more questions for Shona? Oh.
It's not much of a question, Shona, but more of a comment. You gave a presentation 5 months ago when I was on the Going Beyond programme, and I'm absolutely amazed how much progress you've made in 5 months. So, well done. And
Thank
thanks.
you. One more question?
There was one more question.
Possible, Stuart. Hi, Shona. So working through the Green Plan back at our trust, I think one of the places that we struggle more is, you're absolutely right, everybody is on board with the Green Plan and like the idea of that, but it's making the examples a bit more sexy. Like just talking about switching an inhaler around, it's just a bit dull, isn't it? Whereas if I talk to people, well, luckily we've got like the Isle of Wight around, so we can talk to people around drones, things like that, reducing sort of fuel spent on travel and those sorts of things. But I think that's where, particularly with my little financial accounting head, I struggle, I think, in terms of taking something that people agree with and is the right thing to do, and just actually making it sound a bit more jazzy, a bit more interesting to capture attention. I don't know, it'd be really interesting to hear what you think the best example that you've heard of recently of something that actually just captures the imagination as well as sort of has led to the sort of carbon sort of reductions as well.
Yeah, so I think that the challenge we've got, you're absolutely right. Some of the bits are really exciting and really interesting, and kind of doing things like zero emission ambulances and being cutting edge on that is fantastic. Asking people to turn the lights off and turn your monitors off, not so exciting. There's a couple of examples that help with that. So Royal Berkshire, so Nikki, the CFO there, has done some great work, and we're also doing a similar approach in Kent and Medway ICB of an app for staff where they can sign up, and you can do it in lots of different ways to make improvements yourself, and then you get a bit of competition between staff, you get competition between wards and departments, and staff often respond really well to that when you add a bit of a competitive edge to it. So that's one of the ways that I've seen that I think is really good of making it a little bit more sexy.
Okay, thanks, Shona. Can I just have a quick 2 comments? So you mentioned earlier on your sort of personal journey. One of the things I want to say about getting involved with any of these is we've seen from experience that these work streams, so we headed a work stream with generally a DOF and a deputy, somebody like that, and invited people to get involved. That's a really safe space for people to get involved and grow their network, and we've seen some really good examples of how people have really benefited from getting involved in this, and Shona mentioned her benefits. And really, really excited that we were the first academy to put sustainability in as a work stream of our own. So it kind of came about at the very beginning when we were trying to decide what to do. I know HFMA have sort of stolen the idea as well, so they've now built sustainability into part of their strategy. So really pleased that we did that. Thank you very much.
Thank you.
so we're on to Lay and Natasha, please. Oh, yeah, sorry. So if you're struggling to get onto Wi-Fi at all to use your Slido, the local Wi-Fi password is events to remember. Should be easy to remember that one, hopefully. And while they're taking the stage, we've also got a few materials down at the front here which we'll give away willingly. Oh, good call. So, and if you're watching online, the Slido login is Southeast Academy 1 year on. So please ask as many questions as you can. Over to you.
Hello everyone, good morning, and it's good to see many people in the room today, and also hello to those people joining us online in this very sunny Friday. Me and Natasha are going to do a double act and give you the latest update on the EDI development in Southeast region. My name's Lay. I'm the Chief Finance Officer at Serene Borders. I'm also sitting on the National Finance Academy on behalf of the Southeast region and chairing the I&D Ambassador Network in the Southeast region.
My name is Natasha. I'm a costing accountant at Berkshire Healthcare and also co-lead of this ED&I workstream. So yeah, moving on to the first.
Thank you. So, you saw that beautiful graph earlier. The EDI workstream is one of the 5 key workstreams under the Southeast Finance Council. I'm not going to talk too much about the national context. We all know there's quite a lot of work ongoing. There's a lot of focus on the EDI development nationally. We come a long way as an NHS finance community, but there's definitely further room to keep us going. So what we're here to do, we're ultimately promoting an authentically inclusive and diverse work environment so everybody working in NHS finance can have a great work experience. There's many things we're doing here. For example, we've got our I&D Ambassador Network, and the ambassador got together on a regular basis where we exchange notes and get the latest happening in their organization, in their system. We have events and have wider discussions with our people in the Southeast region in finance, events like this, or through our staff survey to get their latest view and see how we can be better in promoting the diversity in Southeast region. We're also talking to the national team on a regular basis to see if there's any good practice nationally, and we're comparing our notes with other I&D Ambassador Network across the country. So there's quite a lot of things ongoing. So here's our journey. We started in November 2021, where we launched our EDI program in Southeast region. Ever since then, we've got our EDI strategy approved, and we've got some key themes identified through our EDI staff survey last year. Shall we show the 6 themes we've got? And yeah, if you just quickly. Yeah, I'm not going to talk too much in details about the 6 themes, and I will leave Natasha to do it. But as you can see, here are the key areas. Through talking to our people, we think in Southeast region, this is what we're really going to focus, and our EDI strategy and our action plan are all designed around these 6 themes. So, Natasha.
One thing just to say before I move on, I probably should have put on this slide just for clarity, is that when we launched with this work stream, there were originally 2 groups, like a working group, and you might have heard I&D ambassadors, so inclusion and diversity ambassadors. And then about 3-4 months ago, we decided to merge those groups because we had very similar purpose and wanted to kind of boost the membership of a single group working together. So we're now just the I&D ambassadors, just for clarity. So as has been mentioned a little bit, we did a staff survey, which was a kind of a local EDI Southeast staff survey just to get kind of ask our own questions that we wanted to find out about in order to come up with an action plan, to find out about people's experiences at work, and also their opinions on joining groups like this and what kind of limits them from doing so. So I've got one slide. There's a lot of stuff that came from this survey. I learned a lot about making a survey because I asked, I think there were sort of 6 questions that were all qualitative, and there were 187 responses. So I had to read through 187 times 6 qualitative responses, which took a long time, but I got a lot from it, and then used that to kind of direct our action plan, which I'll show you in a minute. But in terms of a bit of a profile of who answered the survey, so there was probably about 2/3 who said that they weren't from a marginalised group or community, and about 1/4 who said that they were. We asked people whether they had experienced or witnessed discriminatory language or behaviour in their workplace over the past 3 years. So those in marginalised groups, just over 35% said yes. Those not in marginalised groups, it was about 14% said yes. So I think this is important to demonstrate, because for the people who said no to this question, I think it's important to show that this issue is still ongoing and is unacceptable and needs to change. So I think it's important to, whilst this may not be surprising, it's important to show kind of an evidence base that change needs to happen. So we asked people about what those experiences were, if they were happy to kind of share. And whilst I can't put up kind of exact quotes, some of the things that came through that were quite shocking to read were people saying they were sidelined, undermined, or considered a troublemaker if they spoke up due to their ethnicity and or gender. People who were reporting witnessing or hearing open kind of transphobia. People feeling uncomfortable or unable to report discrimination that they see or experience at work, as they think that they will be ignored. So therefore there are issues with the culture of speaking up at some of our organisations across the region. That last one is particularly concerning because it means that when people are having those affirmations, those kind of first 2 bullet points, if they're experiencing that, they're then unable to actually feel like they can do anything about it. So from reading all of those responses, I would conclude that there is clearly an issue and that people are still experiencing difficulties due to discrimination at work, and that change does need to happen. And also I kind of reflected that from the responses there seems to be a relatively kind of clear split between people who really understand or experience discrimination and kind of really get the point of this kind of work and agree with it, and then people who don't. And I would say that that split is around about an 80 kind of 20 split. So then we kind of combined those survey responses with the national action plan, and also some of our kind of quick wins that we had thought about the previous year, into a 18-point action plan, 17-point. I think I've added one recently, maybe not till May. There's a lot there, but Leigh and I over the past few months have been working on kind of going through all of these, prioritising them, coming up with a genuine kind of implementation plan, sort of week by week of what we're aiming to do to kind of approach these. We don't have time to go through into detail all of them now, but we'll talk about them in the roundtable discussion, and we've got kind of handouts of this so you can take them away and have a read. But I will talk about a little bit about our plan for kind of what we're doing next, so which of those kind of things we've prioritised. So this year we're aiming to, and when I say this year I mean this financial year, we're aiming to improve the uptake of career development programmes. So 1NHS Finance has, I think, 10 career development programmes. A couple of them are focused kind of on EDI, and the rest of them have a kind of wider scope, but generally they're sort of organised by banding. They look really good from when I've kind of looked at the detail on them on the website. One thing to take away today would be to kind of have a look into those if you're interested in it for yourself or for the people that you manage. The next one is about, so for all of our members of our group, our ambassadors, we're wanting them to do a stock take on some things to kind of get more information about what's going on across the whole region. So we want to understand what kind of networks, staff networks are available to people in those organisations. Reviewing the speaking up process and culture. We're also in our staff survey that we're going to do this year, we're going to have a section about speaking up because it came up quite a bit in the survey that was an issue. Reviewing current wellbeing support available. Another thing that came up in the survey about when we were asking about working from home. Some people saying that worked really well for their wellbeing or for their kind of flexibility, and particularly if they had kids, it made things, or dependents, it made things easier for them. But equally, quite a few people saying they felt very isolated working from home and that it had negatively affected their wellbeing. So we want to kind of look a bit more into that to think about how we can support. Then the next one is about ensuring everyone has access to engaging resources. I think it seems some trusts do this quite well. If they've got EDI teams, they kind of send out resources on a kind of, you might have heard of like a diversity or culture calendar kind of thing. So throughout the year, mapping out when particular either religious festivals or cultural events or national days or months or whatever it might be happen. EDI teams can send out interesting resources to kind of small bite-sized bits of learning for people to understand more about different cultures or groups. But not everyone has access to those, so we want to try and make it uniform. And encouraging small local celebration events. That's one of our themes, is celebrating differences, and it came up quite a bit in the survey that people wanted a bit more of that. Then commissioning training. So one of the big things that came up in the survey was about inclusive management training. So wanting managers to be more upskilled on how all different aspects of their job as a manager can be more inclusive. There were a number of different trainings that come up, and we'll talk about it at the round table later. And finally, inclusive recruitment, which is a big piece of work. And we've kind of moved it into this year aspirationally, but I think a lot can be done to improve kind of structural sort of discrimination that can happen in recruitment. So yeah, I've talked quite a lot about that, so I probably won't go into great depth about the next year in the rolling, but we can talk more about it at the round table later.
And just to say, this is not just me and Natasha's kind of having got all of this out. And we discussed those with our IND ambassadors, and we discussed this with our national EDI leads, and we discussed that with the Finance Council in Southeast region. So I know it still sounds quite a lot in terms of the action and the work to do, but I think these are the areas really shouted out by people. We really need to keep on going with all of this work.
Yeah. So, passing back to you, I think. You want me to do this one? Okay, sure. So, in terms of what we've asked your leaders, or the leaders in the room, what we're asking you to do next.
Right.
You want to do this one?
Yeah, I'll go with that. Okay. So, we presented all of those, and the staff survey, our journey so far, and the actions, and to the CFOs and DOFs at Southeast region, and we actually got quite a lot of support, and I still remember some emotional comments we've got when we presented that. So we will keep going and present to our leaders in the system on a regular basis. So here is the list we ask them, the CFO and DOFs to do. We ask them to renew their commitment in the EDI development. We ask for their support to get us more IND ambassadors. As you can see from the data showed earlier, we currently only have 33 IND ambassadors in Southeast region, and this is the lowest compared to the rest of the regions in the country. So we really need to push more and get more supporters and more ambassadors. So we ask the CFO and Dov can promote this for us, and hopefully by September time, we will have at least one ambassador per organization to join us. We asked them to promote the EDI work, including the annual staff survey. So we're about to launch our second year of the EDI-specific staff survey in October time. Please do watch out and try to complete that as early as possible. We also ask the finance leaders to continue promoting all those EDI-related programs in their organization, in their system, including the Break Diversity Barrier program, the sponsorship program. I know we're going to have a session about that later, and also the Going Beyond and the National Finance Leaders Talent Pool. And we will be reporting the participation and people's progress throughout this program to the finance leader on a regular basis. Okay, so we talked about what we're going to do next, our action plan. Natasha just talked about them. And we talked about what we want our leaders to do to support us. And now this is what we would like you to do to support us. We wanted you to have an open mind, engage with the work we're doing, and do talk to us, feedback to us, your thought and what we can do better. And join us as ambassador. We do have a short video about how life's like being an ambassador. Can we click that? Or Stuart, are we okay with time?
We are a little bit over, but
Oh, right.
we'll lead into tea break.
Okay.
Okay, great.
Oh, I don't know if it's going to work.
Just click. Oh.
It might not work.
Oh,
Might be
maybe
better
not.
to
That's
listen to
fine.
questions.
We will send through the slides where you can just click the link and access to the One Finance website. The video is really good, only 2 minutes, but there's a lot of information, and it tells you all the details if you're interested join as the ambassadors. And that's it. This is the end of our talk. I'm very happy to take questions. Thank you.
I've got 3 Slido questions for this one already. Is the action plan printed and widely circulated? That's one question.
Printed and widely circulated?
Yep.
So we have printed it today, so everyone will be able to take it home with them. In terms of widely circulated, we've drafted a newsletter that will be sent around to everyone shortly. The content's there, it just needs to be made pretty and then sent out to everyone. So yeah, that will be widely circulated.
We're working on getting those on the Southeast pages of One NHS Finance as well.
Yeah, I think I have to say it's relatively hard out of the prize because we the national EDI strategy just got refreshed recently, and there's a lot of work and we've done in Southeast region. So we're hoping. So we were hoping we could integrate all the work done at national level, at a regional level, and then come out with the most kind of effective set of actions for people to get on with. So yeah, we will be circulating the details soon, very much.
Okay, I've got 2 more. One's a fairly easy, quick one, I think, and one might be more tricky.
Oh dear.
So, how can we find out why finance staff don't participate in the annual EDI?
Mm-hmm. Do you want to say the other one as well?
The other one is the minimum of 1 expected to be from the finance community, or can it be from the organisation?
So the first one, were you talking about the survey, the annual survey, or were you just talking generally about people participating in EDI?
It doesn't say, but I think they mean survey.
Okay. Why people don't participate, I would imagine it's due to time. People being very busy and inboxes being full. But I think that is why we're asking leaders to be advocating for this very clearly and strongly to all of their members of staff. Because as you can see, we've used directly feedback from that survey in what we're wanting to do. So it's very important we get everyone's views. So yeah, it's kind of up to people, word of mouth and everything, to get people to answer it. It's not a long survey, 10 minutes max, promise.
And I think last year, because it was our very first year doing the staff survey, specifically on the EDI in Southeastern region, so actually we learned quite a lot about how we can engage people better and to have a better response, because we only have 187 response for last year. So this year we set the 40% minimum response rate and ask all the CFO and DOF to push in their own organization. And through the One Finance Council, we will keep sending you the reminder and promoting the survey, because we really need to hear more from our people on the key things they want us to do. And we are actively monitoring our progress through all those good actions identified, and to continue pushing for the EDI agenda in the region.
The second question was about whether it's only finance people. I think it's primarily finance people, but we do have one or two people in the group who aren't finance people. We've got someone who's a kind of an EDI specialist in their trust, so not an accountant, and it's really, really useful to have their input because they know a lot about like what's already going on. And also I presented this kind of presentation to the finance, contracting and procurement team, like bigger team in my trust, and I think that anybody within those what would you call them, divisions, teams, would be appropriate to kind of join this kind of conversation and be doing similar work within their own teams. So I think the scope is open and welcoming. Everyone, come and join if you're interested.
Yeah, I think actually I asked that question a few times myself and to the national team and also in the region. I think at the moment, the I&D ambassador is still mainly the finance people, but exactly as Natasha just said, some insights and some learning from the non-finance people and the wider work the organization and systems are currently doing or have done successfully, that's very, very helpful, helping us shaping our development in the finance area. Thank you.
Yeah. Any more questions?
No more questions? So now we can go and have a coffee soon.
Perfect. I was just going to say, can everyone thank Leigh and Natasha? So thank you. So we've heard from 3 of our work streams, and I think you can see everyone's been exceptionally busy in the last year, and there's lots of good work going on. So we're going to go to a break now. Can I just ask, we were going to be breaking till 11:45. I know we're a little bit later. Can I just ask that people in the room are back here and people online at 11:55 instead? We'll push lunch out slightly, only slightly, Patrick. Don't look so disappointed. Okay, and just to remind everyone, we will be using Slido throughout the day, so please keep using it. As Stuart said, it's South East Academy 1 year on. That's what you can find the Slido event under. So, okay, we'll be back here at 11:55. Thank you. Hi everyone, can I ask you to just come and take your seats if you're in the room so we can start again, please? Okay, welcome back. So we've now got another update for one of our work streams. What I just wanted to say, so everyone in the room has been able to see this, but I've put up the Slido. So there is, it's South East Academy, as I said, 1 year on. Please use it if you're following us on kind of like online as well. And Stuart and I will pick up the post that you're putting on Slido. So, as I said, next work stream. So can I invite Karen and Nadeem to the stage, please, to give us an update on the Skills Development Network.
You're kicking off. Thank you.
Good morning, everyone. So, Karen and I are going to talk to you about the Skills Development Network work stream. So, just to do very quick introductions, I'm Naeem. I'm currently on secondment as Deputy CFO at Hillingdon Hospitals, which is actually in northwest London, but my permanent role's Oxford University Hospitals, hence I am still a South East region person. And I'll let Karen introduce herself.
Thank you. I'm Karen Seabridge. I'm one of the Deputy Directors of Finance at University Hospital Sussex, based down sort of Chichester, Worthing, Brighton. Quite a big batch down there.
So, the Skills Development Network. So, I think the thing that people most know the Skills Development Network for is obviously the SDN programme and all of the work that happens around creating opportunities for finance, procurement, and digital health and informatics, and really important that we remember that it's more broad than just finance, and that we sort of make sure we try to include procurement and digital health colleagues as much as possible in the work of the programme. So you'll be familiar with all of the resources and sort of the graphics from the SDN website and the events, the conferences, the programme, the e-learning that we have. But the work stream is slightly broader, so it does encompass trying to shape and develop the SDN development programme. But within that, we've got a broader set of objectives as well around equality, inclusion and diversity, obviously overlapping with the main work stream, but in a way that's a reflection of the fact that EDI kind of needs to be built into every role and every person's sort of remit. We talk about career development and talent management, so at all stages of career progression, from right from the top to the bottom of the finance function, and we're also focused on recruitment, retention, and consistency through the finance staff and through SDN agenda. We've got some overarching workstream activities that we're trying to do, and some of that is, as Hannah was talking about earlier, with sort of engagement, so supporting the engagement of the work of the academy, and we've got some particular things that we're going to focus on, and I'll come on to sponsorship in a moment, but certainly helping to sort of see where our strong spots are and some of our weaker spots, and try and develop on some of those to move engagement forward. We want to develop a communication plan, because a lot of this is about communication and making sure that everybody knows what's going on and how to access the various things that they can access in order to support development in their departments. Articulating the work of the programme, and we've recently had a number of colleagues volunteer to support us in the SDN workstream, so thank you to those people. If anyone else wants to get involved and help us, please speak to us today. And then map that into the national strategic priorities. So there are our objectives. I think, Karen, you're going to talk about the first three, aren't you? And I'll talk about the next three.
Thank you. So we've got 6 objectives that we're looking at. So our first one is about local development programmes to support talent management. So there's a huge amount of stuff that National are doing, which is absolutely fantastic. But what we were finding is that we wanted stuff that was a little bit more local for the regions. And what we thought then is it would help people who are trying to, everyone's busy, everyone's juggling, and sometimes people sort of saying, I can't really travel into London, I don't want to do this. So we're thinking about trying to do what we can locally, but also local talent management means that we can kind of keep developing the networks and people can kind of get to know each other, move around, and it will sort of all tie together and really help with what we're trying to do. Our second objective was to look at the national finance curriculum, and we wanted to look at equability of training. So what we were seeing when we sort of spoke to people was sometimes some organisations could send pretty much the whole finance department, other people were saying it was limited to one, it was like a first come, first get served, and it wasn't quite sort of looking like everybody got a fair chance at it. And we were sort of looking at how could we bring that more locally, and that's some of the work we want to progress with the group as we move through sort of the next year, sort of building on the work that's happened in our first year. The third one was about consistent level of skills across roles. So we've found that we've struggled to recruit in our patch, and it was great to hear from Hannah that she hasn't had the same sort of issue, and we'd love to learn what you're maybe doing. But we were seeing that some people were one grade in one organisation and they had a set of skills, but another organisation looked for something different. Again, it was trying to make fairness and equability, so we thought that would help recruitment, we thought it would help retention, and we thought it would give opportunities. So it's really exciting stuff that we want to try and build on as this year comes on and really develop stuff locally for the local populations with sort of the ethos of skills development in the background. I'll let Noam talk to the next objectives.
Thanks, Karen. So improving collaboration across the region with the finance community, so that's really important, and we've touched a couple of times on engagement, which is something that we definitely want to improve. I think if you think about the shape of Southeast region, I've sometimes heard it referred to as a croissant, and if you can imagine a map of the south, with sort of London sort of there, but then you've kind of got Kent, Surrey and Sussex along the bottom, and then the side of the croissant curves round to the west of London, with Hampshire and Isle of Wight, Frimley, and then the Bob system heading up into the top of Oxfordshire. So it's And actually, I don't know if we're unique, but we're certainly different from some of the other regions in that we don't have a kind of coterminous HFMA branch either. We've got Kent, Surrey and Sussex, we've got South Central, both really strong branches of the HFMA, both very sort of good at supporting locally, but kind of forming two halves of the Southeast region. And so I think one of the things we want to do is get people thinking about, for all of us in the room, get us thinking about the Southeast Academy as the overarching academy, working with all of the various stakeholders, obviously including the HFMA branches. But the branches are so strong in what they do, we obviously don't want to try and sort of change that. It's just make sure we're working well together. So objective number 5, to increase the number of sponsorship programs within the region. And so some of you may have heard me talk about sponsorship programs before, because I'm trying to get round and talk to some of the deputies meetings at the moment, and I'll be coming to Hampshire and Isle of Wight, I think next week or the week after. But sponsorship is, and Sandy and I will cover this in a bit more detail. Sandy's my sponsee. We'll talk a bit more about sort of the benefits of it, but ultimately I think it's a really good way, as Leigh mentioned earlier in the EDI work stream, it's a really good way of supporting career development particularly for people in underrepresented groups, but for everybody, and alongside things like the career development programs and all of the other initiatives that are going on. So I think sponsorship can be really powerful, but we'll come on to that in a bit more detail. And to develop structured programs of secondments and rotations and diversify trainee skill sets. And as I mentioned, I'm on secondment at the moment, and I'm definitely building a more diversified skill set, and it's not always easy to do, but it is, again, those secondments can be really powerful in sort of supporting learning at all levels. So how do we try and make that something that we can do more throughout sort of different levels and give more and more people the opportunity to move around, build skills, build experience, which ultimately will create a more resilient talent pool within the region.
Okay, so what we have as one of our overarching aims is bringing out the best in everyone. Is trying to really sort of look at what we can do to sort of support you, support your staff, and really sort of try and grow the NHS finance offering and what's out there for people. So as you've heard from Naeem, he's spoken to deputy groups, he came to Sussex, really a lot of positive interest in the sponsors and sponsees programme. I did sign up after that, so I am becoming a sponsor. I didn't have my arm twisted too much by Naeem, I promise. But we're also looking, as I said before, about things locally, not to take anything away from national, but we just want to sort of try and do sort of stuff that we can have local and keep building the networks. And we wanted to link in with the really interesting volunteer programme that East Kent are doing. This touches on the work that I know Lois is leading on with getting into schools. So they do a sort of a collaboration with local schools for 16 to 18-year-olds. And there's benefits for both parties. There's hopefully it's a bit of a recruitment drive, but it's to actually show that there's more jobs than just becoming a medical professional or, you know, what do you think of when you think of the NHS. It's something we're really keen on. We've started locally trying to reach out with our colleges, but I will catch you, Lois, to see how we can be more effective, because we, a few years ago, recruited some really good apprentices, and they've stayed with us and now becoming sort of on their journey to becoming accountants. We're about to do that again, and it's a really good way of bringing people in, especially when, as I said, we're struggling a little with recruitment. How are we going to do this? So we're going to look at surveying the local finance staff. We are definitely going to learn from you, Hannah. We're not going to make loads of it's not Hannah, sorry, it was Natasha. We're not going to have loads of qualitative questions, I promise. We're going to make sure that we try and look at where people's gaps are in terms of skills, where we can broaden engagement, because we really want people to become sort of involved in all of this. We'll do some sort of data gathering, so when we come, hopefully this will be an annual event, when we come and present, we'll have some lovely graphs and charts and talk about all of those things next time. I'm going to move to the risk before I go back to the successes. Capacity. The more people that get involved, the less the burden is on each individual. We've got a great little group going. We've got meetings we're setting up monthly. At least one of our team members is here today. So you know, we're looking for people to join us, because then it just sort of spreads the load a little bit. We've got 9 people. We had our first meeting in March this year, and we're sort of kicking it back off again, sort of to go along the new school term. We've got our action plan in place, which we've just gone through our objectives. We've got 3 sponsors signed up from that membership already, so we're sort of swelling the numbers. And as I've already said, Naeem's done some really good presentations. You will have seen the annual offering. You've got the coaching offering on your desks at the moment. Looks really, really good. And I think it's such a good offer to take advantage of that. We've got the Skills Development Network programme, so there's a huge variety of courses that people can come involved in. We're always welcome to suggestions. There might be other things that doesn't quite cover. You said hot off the press, I think the talent management we heard about earlier. Again, there's a huge amount out there that people can access. And our final bit is, I know you're all going to want to get involved, so we thought we'd make it easy. How can you do that? So join our work stream. You don't have to come every month. You can dip in and out. You can sort of share responsibility. You might just be really interested in one part of it. That's absolutely fine. Please suggest to Stuart, Lois, Naeem, myself, anything you would like to see included on the programme. It's a really, really comprehensive programme, but there's always things that we've not necessarily thought about. Consider, it feels like we're doing a massive pitch for Naeem. Consider becoming a sponsor or a sponsee. You'll hear firsthand in a minute how that's really working well. Promote skills development. Keep promoting the academy everywhere. Talk about it everywhere. Present it. And then, of course, come and chat to us. We're here all day, and we'll be happy to either take questions now or in the break. And, of course, we've got the round tables later. So that's it from us. So thank you very much.
Any questions?
Oh, couple.
Yeah, I just wanted to know a bit more about the coaching you're offering. It's obviously going to go through HFMA, but who's the coach on the other end? Is that someone else from another NHS organisation? Who's the person sort of going to give the coaching back?
I'm afraid that's not. It is part of the national HFMA offering, so I don't actually know that. I don't know if everyone does. There's lots of details in the packs, but Stuart might know more.
Stuart knows a little bit more. So there is a pool of coaches. We're asking people who want a coach to apply for a coach, and then we, or HFMA, will pair them up with somebody, and it will be a sort of joint approach. So we'll find somebody that suits the individual.
And my next question was about the online learning modules. Is that the same as that you have on ESR?
Sorry, the online
learning modules that your skills development network.
So not the same.
How do you access those? Are they through the ESR system?
No, they're through the One NHS Finance website. Skills development, sorry.
So it's something separate. Okay.
Yeah, I think what the ESR is, I think there's a huge stuff there as well. But this is going to be sort of contemporary. Each year there's going to be new courses added. Whereas I think the ESR ones are sort of blocks of learning modules, have their own value, obviously.
Okay, thank you.
So I'll just start by saying how fantastic the offer was, I think, this year. Having that all in the one single prospectus was absolutely fantastic, I think. So thank you for that. Just a bit of an offer, really. So I'm Nikki Burnett, CFO over at Surland NHS Trust. And I do quite a lot of work with the Going Beyond programme, and also been supporting in bringing together some literature with the national team around sort of returning to work after maternity, options during maternity, all of those types of things. And we've not really spoken about anything locally we might want to do around anything like that, around flexible working, and particularly sort of around parenting and getting that within and building the confidence of sort of working mums and their ability to continue developing their careers and not seeing some of those things as limiting factors. So I think I'd really like to be involved if there's anything like that we can do across the region, and really just start to promote some of those benefits.
Oh, absolutely. We'd really welcome. We'll have a chat afterwards and connect you. That'd be wonderful.
Any more in the room? I've got a couple on Slido, if there are none in the room. So, first one, this is one for Naeem probably. What are the key strengths of sponsors? Key strengths of sponsors?
Yep. So, I think I don't want to be too prescriptive, because I think one of the things that I've learned from being a sponsor is to try to be quite open-minded and not think that I've got a particular strength here that I can support a sponsee with. Actually, it's to sort of be as I say, be open-minded and ask the sponsee how it is I can help them. So I think fundamentally, if you're a sponsor, your key strength is that you're going to be in a more senior role to the sponsee, and your role in that is to support and guide them in developing their career. So I think the strengths you need are mostly about your commitment and enthusiasm to your role as being a sponsor. But what I wouldn't want to do is say you need to be someone who's really personable or someone who's really good at the technical side of finance. I'd say it's for everybody. And I would say that because I'm going to ask everybody to sign up to be a sponsor, but I also want people to sign up to be sponsees as well, because I think it is, it can be a really powerful relationship in supporting career development. So it's a bit of a cop-out, but open-mindedness and enthusiasm, but also commitment to meeting with the sponsee on a regular basis and supporting them.
Thank you. I've got another one for Naeem, actually. Not a question, but just to confirm, you're going to Hampshire on Monday. Is that right?
Is it Monday? Yeah. Great, thank you. Yeah, I won't get into too much detail, but I've been ducking in and out of this session because we've not quite completed our audit where I am at the moment, and so my diary is changing on a regular basis at the moment. And but I will be there to join the meeting, Hampshire and Isle of Wight. Brilliant, thank you. And Kent and Medway. I'm coming to Kent Medway quite soon as well. Yeah. So yes. So yeah, and I'll get to Frimley, and it's going to be Surrey as well. I need to get some dates in the diary, but very happy if anyone's in the room from those systems to give me a call, drop me an email or give me a call, and we'll get some dates in the diary.
Okay, I've got one left on Slido, which is probably the more challenging of the questions. Yeah, question for Steve. Is there a sense that the same roles across organisations, systems and nationally should be at the same grade/skill level?
So So I think yes, and broadly speaking, they probably should be, shouldn't they? Agenda for Change being a national pay scale. So I guess there is I suppose if there are specific examples of where they're not, then I suppose that should that could be something that we could think about looking at as a work stream, especially if it's something that sorts of impedes career development for people. But I do know there can be inconsistencies. I think one of the challenges that I think I've sort of encountered in the last few months is, particularly as we start to move into acute provider collaboratives and more sort of joint up working and collaborative working, whereas previously you might have different roles in different organisations that may have varied potentially by a grade. Bringing those organisations working more closely together might bring that into slightly sharper focus. So yeah, it's probably something we are going to have to think about.
Just going to add my perspective. Steve Gooch, Regional Finance Director. I suppose, so I agree with completely what Naeem said, something about national pay scales, consistency. I think I'd reflect that we do really struggle in this consistency area, don't we? If I think about the work that we've been looking at nationally, especially around how do formal qualifications get applied to finance jobs. That's a really emotive area, isn't it? That's generated a lot of debate, and I know there's been pros and cons for whether we standardise on that. So there is work being picked up nationally within the work streams on this. So it's trying to feed into that. But I think we need to strive for consistency, because it's about equity, isn't it? It's about equity and fairness for our staff. And if people think they're being treated differentially from someone doing a job down the road, it does. It's not very motivating, is it? So I think that's what we need to strive for. But it's challenging, and there's lots of examples I can think about that I've heard where people are really struggling with this issue. But it is being picked up and looked at through, I forget which work stream it's in, but there's definitely a piece of work looking at it. Maybe we can dig out some details and share that afterwards. Thank you.
Thanks.
Is there any more for any more? No? Okay.
Great.
So I think we're moving on to the sponsorship session now with,
so
we're going to invite
I'll invite Sandy up to
Sandy, who's on one of our sponsees in the patch. She's going to do a double act with her sponsor.
So no slides for this one. Sandy and I are going to have a chat, and then we'll invite you to sort of join us, join in with some questions. So you've already heard me introduce myself. I'll let Sandy introduce herself.
Hi, I'm Sandy Johnson. I work for South Central West CSU, and I'm Finance and Reporting Manager.
Thanks, Sandy. So, as suggested, so I'm Sandy's sponsor. Sandy's my sponsee. When did we sort of get paired together? About 9 months ago, maybe?
Yeah, I think so.
I think that sounds about right. And I'm just checking my phone for some notes. I'm not going to start tweeting or anything. Sorry, bear with me a second. You only tweet at the HMA National Conference, don't you?
Tesco delivery.
Yeah, so yeah, definitely not doing that. So I think what we wanted to do was just sort of have a relatively informal chat. So I think I'm going to start by asking Sandy why you wanted to get a sponsor, why you looked for a sponsor in the first place. What was your main motivation for that?
So I was actually really wanting a sponsor to advocate me in the system, and what happened, broadly speaking, to develop my career, but also because I happened to be on a secondment actually just before COVID hit. It was a maternity leave cover, and I was really wanting to keep a role at that band. It was a promotional role, and I was coming across massive issues with the fact that I hadn't finished my exams, and so it was becoming quite problematic, and I realised that I needed to finish. I'd had a break from my studying because of some difficult personal issues and family life, and just, to be honest, just working. I'd actually managed to keep getting promotions, and the more as I did, the harder it became to study. But it was that realisation that I cannot progress until I've done my exam. So actually COVID did me a favour in a way, because I was so bored I was forced to study. So that's what happened. Yeah. So, but you know, I was going for some other interviews, some permanent promotion interviews, and I wasn't getting them. And actually, you know, I think certainly in the last sort of 9 probably years, I would say I've been quite a strong interviewee. I've generally done quite well in interviews, and to suddenly have an issue where I wasn't getting any of the jobs I was applying for was a bit of a shock, and it didn't do a lot for my confidence. So I was really hoping to have some support from a sponsor, so not just advocating me, but sort of supporting me with the application and interview process, because that was clearly an issue. So yeah, so that's how the sponsor, my request to be sponsored came about, and then we got matched, didn't we?
We got matched. So yes, there's, and I'll say a little bit about the matching process, just to clarify exactly what that is. So if you are someone who wants a sponsor, you apply through the One NHS Finance website, and if you want to volunteer to be a sponsor, you do the same. And so I'll give a little bit of background about the aims of the sponsorship programme and what it's trying to achieve. But as Sandy said, advocacy is a really big part of it. So I think, you know, we've probably all come across examples of where a CFO or a deputy CFO has kind of sort of taken someone in our department under their wing, and sort of supported and ushered their development into more senior roles. You know, sometimes it's kind of obvious because that's the person who's kind of putting themselves forward and really positioning for that opportunity. And sometimes it's less obvious, and sometimes there's some subjectivity in there. Maybe it's because the senior person sort of sees something about in that individual that reminds them of themselves, or but sometimes it can also feel a little bit unfair for those people who don't feel they're getting that opportunity, not really being taken under the CFO or deputy's wing in quite the same way. And I think that sort of experience it happens in all professions, it happens in all industries all around the world. It's not specific to the NHS or to NHS Finance, but there is an opportunity, if you can kind of try and replicate that and make it a bit more accessible to everybody, that you can harness some of that power of that kind of taking someone under your wing and trying to support their development. And the sponsorship programme, I think, aims to get there. Now, it's not going to be able to do it in exactly the same way as if Sandy worked in my department, in my organisation, but there is a in an ideal world, we might be working in the same system, and we're not, and I'll come on to that, and probably we'd be a bit closer together in grade. I think sponsorship will probably work at its most powerful, sort of when you've got a sponsor and sponsee who are probably a couple of grades or a couple of levels apart if you think about a department hierarchy. But I'll come on to how Sandy and I got paired, and the fact that we're not in the same system and we're probably not only a couple of grades apart, how I don't think that's hindered the relationship at all. So I applied to be a sponsor, and I sort of thought I'd get paired with someone locally, and I thought I'd get paired with someone who was sort of perhaps a BHC and looking to progress their career towards where I am. And the first, I got sent an email through with a little application form on it from a sponsee, a potential sponsee, and One NHS Finance sort of said, here's this application form from someone. And I think that individual was a band 7 and they were working in a different system and they wanted some very specific types of support. And I kind of looked at it and I thought, I'm not sure I'm going to be able to help this person. And I emailed back and I can't remember if it was Natasha or if it was Megan from One NHS Finance, and said, look, I'm not sure that this is the right match for me. So maybe I'll wait for the next one to come along. And then a few weeks later, I got Sandy's form through, and actually in some ways quite similar, not in the same system. Sandy's a bit more junior in terms of where I thought I was going to be sponsoring someone. And I sort of thought, okay, well, maybe this is how it's going to work. Actually, I don't want to keep sending applications back. I want to support someone. And actually, what Sandy had done in her application was she was really clear about the things that she wanted to get from a sponsor and what, the support she wanted. And I thought that was important. it was good to be matched with someone who knew what it was they wanted from their sponsor. So I think that's important. So I think both as a sponsor, you need to know you want to do it, and as a sponsee, you need to be putting a level of commitment into supporting your own development. And Sandy definitely owns that. So so that was the matching process. So as a sponsor, you're kind of in the driving seat a little bit because you get a bit of choice about who you support and if you think that you're going to be able to support that individual. I think partly what that was a reflection of for us in South East is we're, in terms of the numbers of sponsors and sponsees, I don't know if we touched on it, I can't remember if we touched on it directly when Hannah was looking at some of the engagement stats, but we're 6th, I think, out of the 7 regions in terms of our numbers of sponsors and sponsees. That's crept up by a couple of individuals in the last few months. But if we had more sponsors and more sponsees, actually, we would probably be able to get closer matches and be able to make this even more successful. But Sandy and I are here because I think we have, well, hopefully Sandy's found it successful, otherwise this is going to be not such a great presentation. So
put that on the slide.
So I guess, so Sandy, my next question is, so in some ways, being paired with you wasn't what I was expecting. I do think it's been successful. Do you think, so 2 questions, is it what you were expecting and has it helped?
So originally, I have to say, I was a bit sceptical of the fact that Naeem wasn't in the same system as me, because I was thinking, well, how will this work? He doesn't know anyone I know, and I was a bit worried about that. But equally, the time that Naeem has offered me is just unprecedented. I wasn't expecting it. He's in a demanding job, in a very demanding secondment, but he actually has looked at my application form, like my supporting information, gone through it, offered tips, tweaks, insight. He's helped me prepare for interviews, just sort of also challenging me on the types of roles I was applying for, because I think sometimes, you know, maybe I'd been guilty of applying for a role because it was at the band potentially that I was looking for, but it wasn't quite the right job for me. And I think that's been really important, actually, to have somebody challenge me and say, actually, is this job where you want to be? Is it going to lead you to the next opportunity? Which has been the most important question. So yeah, I just think ultimately, with any situation, the gift of time is the most generous gift you can give. And I've benefited enormously from Naeem's time, and when he hasn't been available, because he's, you know, in a demanding role, and we've had to rearrange, it's been rearranged very quickly for near that date. So I've never had an issue getting hold of Naeem. He's always made himself available, and yeah, I've found the whole thing. I would thoroughly recommend, I know this is jumping a bit, but I would thoroughly recommend people to join up on the sponsorship scheme. And has it worked? Well, I've got a promotion. I've got permanent promotion. So yes, it has worked. So thank you. Does that mean I have to offer you a paycheck now? Like?
No, not at all, no. So there's no remuneration for being a sponsor. I'd like to make that clear.
In public.
Absolutely. So good. So yeah. So I think, you know, it's been valuable for me too, and I think that's a really important point to make about signing up to be a sponsor, is that I get something from it. So I think, you know, first of all, it's quite nice to get that feedback. That in itself is rewarding. The fact that Sandy's given that feedback in this room is hopefully going to, you know, help me in terms of networking and my own career development going forward. I think, you know, talking to Sandy about, you know, some of the barriers she's faced, and you know, talking about her exams and things, and some of how that can impact on you know, your ability to apply for certain roles in certain organisations. And Steve just touched on the fact that there is a bit of inconsistency there, and it's a debate that will continue. You know, there are 2 sides of that debate, but it helps me to think about it and hear firsthand from somebody. Whereas, you know, yes, I could have that conversation with someone in my team, but as we all know, it's always really difficult. Whereas I've committed to make sure that I touch base with Sandy on a regular basis, so I get to hear from someone who's got a very different perspective than my perspective. in terms of their own career development. And I think there are definitely benefits to it, and there's also the benefit of being quite selfish as a deputy CFO. The fact that I want to encourage as much development. I want to, the next time we go out for any number of roles in our organisations, we want to make sure we've got the strongest possible pool of candidates applying. So I think for those of us in more senior roles, we've absolutely got a really important role to play in trying to develop that. We've talked about talent management and succession planning, and I think the sponsorship programme can be a really powerful part of that. So yes. Is there anything that you would add, Sandy, in terms of you're not under pressure to do so?
I'm not sure if I would add anything. I just think it's really rewarding. I think, you know, in the future I'd like to also sponsor. I think it's something that you can keep giving back. I'd like to do that. I kind of done it informally but not formally, so I think, you know, I don't know if there's a limit to what band you need to be for, I don't know if that's something that's ever been raised, like, but no, I think it's a really lovely thing, and when you've had the support to be able to give it back to somebody else, so yeah.
So I'm not sure that there is a limit, and what I would say is, I think sponsorship probably would work at pretty much every level, because you could be, you know, it's that thing about if you're sponsoring someone who's a couple of sort of, however you define a couple of levels, as you know, by grade or by sort of career steps within a structure, you know, you've got the opportunity to develop people, and lots of us do anyway in our teams, just as a matter of course, just as a matter of being a good line manager and colleague and leader anyway. Some of that definitely does happen, but it's about trying to put a little bit more formality to it and make it accessible. So some of us do have good networks and do have the opportunity to have those conversations, and some of us don't. And particularly if you're perhaps not able to get to, you know, events like this, then the sponsorship program can be really helpful about, you know, connecting you with someone who can give you that offer. I think the only thing I would add is one of the things I've realised, and you know, I wasn't sure that I could offer Sandy support in developing her career, because I thought I'm not sure I'd be able to give good advice about getting through exams or perhaps applying for roles at that level. I've been back in London now for 9 months on secondment, but prior to that I'd only been in the South East region for about 2.5 years. So at the point, you know, Sandy became my sponsee, I didn't have a great network in the region, not too, but pretty good in the Bob system, but not great across the rest of the region. That's obviously better now. So I was slightly worried about what I could offer, but actually what I have realised is, a bit like you just said, Sandy, is I think you'd be surprised as someone in a more senior role just how much value people get from just getting your opinion and having access to someone in a more senior role. It's you know, I wasn't entirely sure that I could be helpful, but actually just being able to reflect back and have a conversation and just have, sometimes we're just having a chat, and it's a very informal mentor role. Sometimes there are more specific things, perhaps around applying for a role or giving some tips on applications or interviews, or my thoughts on whether something is a good role to apply for or not. So yeah, you will be more helpful than you think you will be as a sponsor, and that's sort of why I didn't want to say these are the strengths you should have. Fundamentally, all you need to do is make a commitment to make some time on a regular basis, and there are some times when I have to move a meeting, but what I try and make sure I do is just find another date straight away as quickly as possible. Really sorry, Sandy, but can we please move this to later this afternoon or tomorrow morning or whatever it's going to be, because it's important to have that commitment, and it's a 2-year commitment as well, which isn't to say that at the end of 2 years I'll sort of, bye Sandy, your 2 years is up, but it's you know, it's not a short-term thing either. It is a long-term thing. So having signed up in South East region and then come on secondment into London, I wasn't going to leave that commitment behind because we're no longer in the same region. So I think that's important to say as well. Any questions at all?
There are a couple of questions. I think you may have touched on some of these, but has the evolution of the sponsorship relationship changed ideas on how the process will work most successfully?
For us or in general?
think it's in general? Or perhaps from your point of view would be good.
So I think the sponsorship program is probably evolving. So, you know, as I said, you know, the sort of the aims around wanting to support career development, particularly for people in underrepresented groups at senior levels, are still there. That's still a constant. I think you know, as we've talked about, when I first looked at sort of the literature on the One NHS website about same region and you know, a couple of levels and so on, and then I thought, you know, I feel bad for that first person that I kind of turned down because I wasn't able to, or I thought I wouldn't be able to support them. But so it is evolving. It doesn't have to be that limited. I think as long as you're able to make the commitment, it doesn't matter. So I think I did a talk for the Sponsee network yesterday actually, for South East and South West regions, and I think that even just so sponsees get together in a network and they have network meetings online, and different speakers come and talk to them. So even that's kind of a different aspect of the sponsee, being a sponsee and being part of the network. So it's definitely evolving. It doesn't have to be limited to one thing.
Sort of part comment, part question. So a really excellent sort of presentation to hear about your themes. I'm a sponsor myself, and it just chimes with everything I've experienced. It's been really rewarding to be taking part in the programme. I get a lot from my conversations in so many different ways. It was a final point you sort of touched on, the fact that the banding of becoming a sponsor. My observation is we really struggle with you know, people seeming to perceive us to be a CFO or a deputy CFO thing to become a sponsor. Absolutely not. I think really would encourage anyone who thinks they've got something to offer in this space to step forward. The numbers have been really sort of struggling to get up. We've been really hit a bit of a plateau. So I keep reflecting, what is the barrier here? I'm sure time commitment is definitely part of that. But I've stood up in so many forums with all the CFOs in the South East saying we need to really try and boost our numbers here, and the numbers are very sticky. So I don't know, Naeem, if you've got any reflections in that space about what else can we do to try and, you know, obviously publicising it in today, but any other thoughts on what we could do to try and boost numbers, especially at those lower grades? So I've had band 2s, band 4s come forward saying I really would value having a sponsor, and we just haven't got the people in that sort of middle bracket who actually could help, I'm sure, and there's lots of people out there who could do that.
So yeah, I think what I would say is, so you know, and Karen and I talked a little bit earlier about communication and wanting to get the message out, and you know, I spoke to a deputy CFO colleague in part of South East region, not in my system, who wasn't aware about the sponsorship program. So some of this is making sure people are aware. I'll come and do those presentations to the deputies meetings, but actually what I need the deputies then to do is go away and disseminate that and talk about it. And reference it in team meetings as well, and you know, and we can continue to do some of that through the national and local comms we'll do through the South East Academy as well. So yeah, so it's for everyone in the room to, even if you don't sign up to be a sponsor or a sponsee, and obviously you can do both. There is no, you know, everybody can be. Well, perhaps if you're CFO, you may have hit the ceiling. Although you could, I guess you could find yourself a CEO sponsor. But you know, you can be both. But also, please, yeah, go away and talk about it in your team meetings and let people know that this is an option. And even if you don't want to sign up more formally because you're not sure who you might be paired up with, you can kind of do some of this anyway, just by being a sponsor to the people in your team anyway. But some of what we are trying to achieve with the sponsorship program is making it accessible to everyone rather than it having that element of subjectivity. I'll add one more thing, which was I heard from a sponsor that I was talking to not so long ago that their sponsor had told them, you know, sort of had asked them about their career aspirations. This was someone I think sort of 8B, 8C level, asked them about their career aspirations, and they had said they wanted to be a CFO, and their sponsor said, "Why would you want to be a CFO?" And I think their sponsor was a deputy CFO. So why do you want to? Are you sure you want to be a CFO? Now, don't get me wrong. I partly agree with the sentiment. Why would you want to be a CFO? But what I try not to do is kind of put another barrier in place. That's absolutely not what I think we should be doing. I don't think it was. You know, I don't think that sponsor was coming at it from that perspective. I think they probably were but the sponsee took it as quite a negative comment, as if they were being discouraged. And in a way, it's you know, that's the opposite of what we should be doing. So you know, I kept coming back to the point about being open-minded. I think actually, you know, having conversations with Sandy has helped me to broaden my thinking. It's not my job to judge whether Sandy should be going for a job or not. It's my job to support her in going for the things that she wants to do. These have to be her choices. It's her career. So my job is to kind of be an enabler, not a naysayer.
Okay, thank you. So there's only one more thing on Slido, and I think it's kind of the wrap-up thing for this. So there's a comment on here. It says, well done, Sandy and Naeem. I know you both well. They're great ambassadors for One NHS Finance. So thank you.
Thank you very much.
I completely agree with whoever's put that on to Slido as well. No, it was great to hear your story, really powerful, just to kind of see the benefit you get from the sponsee programme. So we are running slightly behind, but that's not a problem. So if we can break for lunch now and be back in the room at 1:15, we're kind of shorten the round table exercise, which I think will be absolutely fine, so Steve can start at 2. So if we break now and come back in the room for 1:15.
waiting for people to settle. Right. Well, hello everyone. Good to see you. Good to see you all. Let me introduce myself. I know see quite a few familiar faces out there in the room, but quite a few people I don't know as well. So I'm Steve Gooch. I am the Regional Director of Finance for NHS England in the South East. As you can see by my lovely pictorial representation of the South East, if you're on a particularly boring Teams call, you can spend your time working out what the different landmarks are. But that slide's going, so don't think that's what you're doing for the next 15 minutes. Look, firstly, so good to see so many people here in person. I know Russian roulette with train strikes and what have you hasn't made it easy, but great to see those who made it in person. For those people online, great that you could join us virtually as well. It's really good, and it's really positive to spend a day talking about the fine work of the Academy. So what am I going to talk about in sort of my 15 minutes? I mean, normally I come to these events, I'm asked to talk about the regional financial position and all that jazz. Not today. So that's my script today was really to sort of big up the Regional Finance Academy, but of course that has been the whole day. So I am going off piste today, which is a bit dangerous. So I've got a few things. I want to briefly reflect on some of the current challenges we're facing as an NHS finance community. I want to share some of the sort of key messages from one NHS Finance nationally. You'd be glad to know there's a lot of overlap with what we've talked about in our session today. And then finally, I'll bring it back and link it to the work of the Regional Finance Academy, which is why we're all here, which we're all trying to support. So that's what I'm going to cover. So let's start really with a huge, spoiler, a huge, great big thank you. It's a thank you to everyone working in the NHS finance profession from me, because it's been a really difficult and challenging 12 months, and it's just reaffirmed to me my huge respect for everyone working in NHS finance, because we achieved so much and we've really risen to the challenge over the last 12 months once again. And the nature of our roles means, I think, you'll recognise this. Naturally, as finance professionals, we are problem solvers. That's what we do in our day jobs. We solve a problem, we move on to the next problem. And I sometimes find that, it means you're always dealing with the difficult stuff, aren't you, in your job? And you take stock and think, actually, we do achieve a hell of a lot, and we should remember that. It's really easy to forget what we have achieved as an NHS finance community. So I put a few things there on the screen here. I won't talk through all of them, but our bread and butter is our financial delivery. Nationally, the NHS delivered financial balance last year, which is no mean feat when you think about the wider pressures in the economy that are well documented, cost of living crisis, inflation, etc. And from a regional perspective, if I think about last year, there was a point about month 5 last year, I sat head in hand thinking, crikey, we're just heading to a, 500-600 million deficit as a region. It just looked absolutely horrendous, and we turned that around. We ended the year in deficit, but that 600 million projection we were heading for ended just over 150 million. And when I think about it, much of that improvement is down to the likes of you, the people who work in NHS finance, because it's driven by the sheer effort, dare I say, the creativity of finance professionals trying to just improve financial positions. And I think in a way, it's a credit to us that we drive a lot of that improvement. Some of it reflects, I suppose, the weakness, and actually we're quite good at finding those non-recurrent fixes that improve the position. And ultimately, the challenge for us is to try and make sure we engage wider colleagues in the service about how we can try and get back to a current financial balance. But I'm under no illusions by how much hard work was done to improve that position. It's a real credit to everyone involved. And we did that against a backdrop of organisational change. CCGs becoming ICBs, huge for staff involved, hugely disruptive. As we move to more system-based working. And to give a specific example, multiple accounts processes during the year. So, a date gets moved to the 30th of June from the end of the year, and people think that's easy. But for finance professionals, that caused a hell of a lot of work as we did part-year accounts. So, all of the stuff we delivered against that backdrop, and then we've just concluded probably what feels like, I don't know about you, but it feels like one of the most bruising planning rounds we've had. It has been really, really tough. And again, back in February nationally, we were staring at about a £6 billion gap between plans and the money we've got as an NHS. We have closed that gap largely, and it's been really testing. I've reflected long and hard about how much it's tested my values and behaviours, principles, when you're having those really difficult conversations about needing to close a financial planning gap. It really does test you, and there's plenty of times I've gone home and I thought, did that conversation cross a line? Was that appropriate behaviour? It's been really tricky stuff, and I think a strength of the NHS finance community is we do come together and sort of work closely on those things, and I think generally stay the right side of that line. But it's been particularly difficult this year, I'd acknowledge that. So we've done all of that. We've got through the planning round, and there's some of the other backdrops we've been dealing with, some of them very pertinent. This very weak industrial action, operational pressures. It never gets any easier out there, does it? And we're working in the finance community to support our frontline colleagues against that backdrop. It's a really tricky ask, and I doff my cap to all of you who work so hard to deliver this. It's really very much appreciated. So thank you and well done. Let's not forget how much we achieve together. Secondly, then, it's not going to get any easier. There's tough stuff out there. There's lots going on when I horizon scan. This is my sort of download of the sorts of things we're going to be tackling in the next 12 months. You'll have your own list. You'll have your own stuff you're working on. Some of this will chime, I'm sure. Some of it may not. But there's, excuse me, I've got my notes on the screen and they're not, they're just flicking forward the slide, so I need to be more careful and sensitive. So you'll have your own items as well, but that's my list of what we're dealing with in the next 12 months. And there's a few themes I wanted to pull out if I could find the right page in my notes. Bear with. So, first and foremost, top left-hand corner, we've got a challenging financial position. I've just come off a call literally in my lunch break about the month 3 financial position for the South East region. We're already 70 million off plan as a region. Our aggregate deficit's about 200 million year to date. So, in simple terms, we are spending about £70 million a month more than the money we've got at the moment, just in the South East region. It's not unique to us. There's challenges in other parts of the country as well. So, and some of that's a legacy of the planning discussion I talked about. We've got a huge challenge this year, more so than ever, and the collective effort on that's going to be #1 priority. How do we try and return the NHS back to financial balance? And it's been a long-running saga, hasn't it, since we came out of the COVID financial regime, which really leads to the recovering productivity slide. So we're still grappling with this issue about lost productivity in the NHS. NHS productivity is still about 16% down on where it was prior to the pandemic. We've seen a huge growth in costs, huge growth in staff, yet typically less work being produced, less patients being treated. That's the real challenge for us, and it's our job as finance professionals to help the service solve that, because you can imagine it's a very topical discussion with government, who rightly feel they have put investment into the NHS. We can debate in this room whether it's enough, but investment has gone in, and we need to be trying to recover productivity. So that remains the key challenge as we try and come back to a current financial balance, I say, which is those medium-term financial plans in the top right-hand corner. All of this we've got to try and do against the backdrop that a service is disrupted by industrial action. I think that's a big challenge at the moment. I keep hearing that actually got ambitious savings targets for the year ahead, and the service is having to manage a huge amount in terms of industrial action. It's a huge, drain on people's time, and therefore stops us doing some of the stuff we need to be focusing on. So that's really difficult. And then allied to that, bottom right-hand corner, there's still more organisational change coming. We've got significant running cost reductions, both I know personally in NHS England and in ICBs as well. Lots of commissioning transfers affecting staff. I'm sure some of you are affected by that. So a real, complex scenario, and as ever, it's really difficult when you've got a hell of a big agenda. People are dealing with organisational change that affects them very personally. It's tricky stuff. So a huge task ahead. I feel like I've really brought the mood down with this line. Wasn't the intention. A huge task ahead. Let me try and just reframe it. I suppose for me, let's focus on the positive. I always say, I look at this stuff and think, yes, there's a lot going on, but there's always a lot going on. What it means to me is the skills we've got in this room, the skills we've got in NHS Finance, they've never been more in demand. You know, we're such a valuable asset. We are really needed more than ever. We've risen to the challenge, as I've just shown you in the last 12 months. We'll do it again. We will do it again. The strength of our network, I heard it right at the start of the day, someone say other functions really envy what we've got in finance. I hear it so often when I talk to colleagues and other directorates. It's so true. You know, we need to use the network. We will meet the challenge we face, because we always do. It's what I've seen in 30 years of NHS finance. I'm always astonished by how much we can achieve when we work together. So, plenty to be positive about, despite the fact we face a challenging agenda. Let me keep going, change tack slightly. So, bit of a flavour of what's coming out of One NHS Finance nationally. You've heard it today, there is so much good stuff going on throughout the various national programmes of NHS Finance, a lot of which is filtering down to the regional programmes you've heard about today. I'm not going to read through this slide, you can read it for yourself, but I just might pull out a few topical areas of what's going on. I mean, second section down, Finance Innovation Forum, it's one of the areas we haven't really covered to a large extent today. I sit on the Finance Innovation, I've just joined it as the Regional Finance Director rep. It is such an inspiring meeting to be a part of, because you get to hear about how much good practice there's going on in different pockets of the country where people put forward their good ideas. So the Finance Innovation Forum is all about sharing those ideas and making sure that where people have solved a problem in one part of the country, we share that innovation and make sure it's sort of replicated. So I really would encourage you to get involved. There's the NHS Efficiency Exchange, which has now been launched, which captures some of the ideas that people have implemented. It's all available on the One NHS Finance website. So click in there, follow the link. And there's, you know, none of this is rocket science. There's a variety of stuff on there, be it, you know, budget holder dashboards, how people have tackled day one reporting, things about better payment practice code. There's you name it, there's something on there where someone's got an innovative idea or just an approach they followed. So I'd encourage you to dip into it and use it, but you've probably guessed this punchline. We do need more ideas as well. We need to boost our numbers. As a region, we have been lagging a little bit. We've improved a bit of late, but our numbers haven't been great. So 2 points I'd make really. Innovation sounds scary. You might say, well, I'm not doing anything innovative. Don't think of it like that. Really, some of the stuff here is actually just something you've done locally, a bit of a process. It doesn't have to be absolutely something majorly innovative. It can just be something quite localised and quite simple that you've done. Actually, that classifies as innovation. And the other thing you might be thinking is, I haven't got time to fill in templates and forms to capture my innovation. There is resource centrally to help with this. The team involved in this will help with that. So it doesn't have to be an onerous challenge. I think obviously it only works if people share what they've done locally. So if you've got good stuff going on in your local patches, do have a look at the website, and I encourage you to share those examples. It's a really good piece of work. So that's the first one I wanted to mention. What else? It's come up a few times. The talent management strategy. Encourage you to look at that. That's been launched this month. You know, it's very pertinent to the discussions we've been having today about how we ensure NHS finance remains a career of choice for people. How do we retain and develop our staff as well? So it's a good strategy worth looking at. Again, what I'd emphasise on the talent management strategy is people sort of sometimes associate talent management with being about the high flyers and the people going up to wanting to be CFOs. It's much broader than that. It really does think about everyone who's in different places in their career. It might be about someone who actually is quite comfortable doing what they're doing at the role and the band they are, but actually wants to see how they can develop and contribute more to their team. So it's not just about the high flyers. So again, encourage you to look at that. It's a really sort of inclusive strategy aimed at supporting staff at all levels. And then finally, from me, on the national updates, again, it's been mentioned a few times today, but there's the second One NHS Finance online conversation. Has been launched now. Excuse me, I'll come back to that. So this is the overview slide. So now launched, 6th of July it launched. This is your chance to get involved. So you've heard today about all the fantastic work of One NHS Finance. Most of the ideas and the stuff you've heard about today came from our original online conversation, where we had over 3,000 people get involved, over 30,000 ideas generated. So it's, you know, a fantastic piece of work that was done originally, and now we're doing a refresh. So I'd encourage you to get involved and share your views. I suppose there's two things really. There's a chance for you to sort of reflect on the priorities we've talked about today, the priorities of One NHS Finance. Are they the right ones? So welcome thoughts and feedback on that and whether they're the right things that we should be doing. And I suppose secondly to that, you can go in and, as well as going in and suggesting ideas, you can look at the ideas other people are suggesting and comment on those. So I think there's something about us getting a sense of, yeah, that's supported by a lot of people. This is really important. We're just keen to make sure that we're on the right path. And we'll only know that from the feedback of all of you working out there involved in the service who know this stuff far better than I do. So please go in, have a look, share your views, say what's important to you. If there's stuff you think we should be focusing on that isn't getting enough attention at the moment, this is your chance to flag it. So really encourage you to get involved. Again, best way in is either via the One NHS Finance website. There's a link on there. I've certainly noticed in the past week I've had quite a few reminder emails with all the relevant details, so I'm sure you have as well. So either use those emails. Deadline for getting in your contributions is Friday, the 11th of August. So please do get involved and make a contribution. I've spoken to both Julian and Peter about this. It's really important. They're really keen to hear people's views as we try and sort of build on the momentum we've talked about today and relaunch you know, the second phase of One NHS Finance. So get involved, please do. And then I suppose the final, I skipped one slide, didn't I? Again, just this slide is staggering. We'll send the slides around, but just when you look at some of the numbers nationally about how many people have been involved, we've heard some of the regional numbers today, but it's a really impressive programme of work we've now got up and running. Huge number of interactions. We just need to carry on building the momentum and keeping up the good work. So finally from me, I'm going to end with the obligatory slide. This slide is compulsory to be in every presentation. You've noticed that today, haven't you? It's just absolutely is. So I'm following the script and including it in my pack. And just bring us back to the work of the Academy. So we've heard today, haven't we, how much is going on, and there's how many, I suppose hopefully you've heard how many opportunities there are to get involved. And what I've taken from the day, and the beauty of this is, you can really choose to get involved in something that aligns with your values or your interests. And that's really important, because I think it just, you know, naturally we always gravitate and we're more engaged when it's stuff we're actually interested in. So there's such a wide spectrum of stuff happening within NHS Finance. Please do choose the stuff that chimes with you and your values and get involved. Absolutely recognise folk are very busy. I talk about this a lot. There's definitely a tension from me, and I reflect on this a lot about. I'll leave this room and I'll go into some conversation about the horrors of month 3 reporting or the planning process. And you know, how do we make sure we try and just keep our momentum up on this, and it doesn't feel like a sort of separate world we enter once in a while. We need to try and do that. And how do we try and replicate some of the good stuff we talked about this room, so it translates to the day job we're doing. And I suppose, again, this day's been really quite inspiring for me to hear the presentations at the front, because I just hear something that chimes with me. I hear people say, the people who've been kind enough to stand on this stage and speak to you today, the common theme I've always heard come through is, actually I found it really rewarding. I was a bit worried about my capacity, but I found it really rewarding. I've heard things like, it's broadened my experience, it's given me exposure to stuff I didn't do. And that's the beauty of getting involved, isn't it? And you know, my micro level experience just on the sponsorship program, I was the same. Oh crikey, I haven't got time for this. But then I've signed up, got you know, I'm a sponsor. It's been fantastic. It's just been such a, you know, it's a conversation I really look forward to. I get a completely different insight from someone who works in a bit of my team I have no involvement with. And just you know, just giving me a completely different perspective on a sort of very different area of the workforce. It's been great. So you know, do get involved and get over those reservations about I'm too busy, because you'll get the benefit. I suppose allied to that, I'm slightly conscious that actually, and I'm probably preaching to the converted in this room, because you know, you're all here, you're all demonstrating your commitment. You've all turned up here today. So I think there's something, we've all got responsibility, those of you in the room, those of you Those of you online watching, I think I definitely say spread the word. Spread the word. You know, you're believers and you're signed up to the Finance Academy, but just make sure you keep spreading the word. I heard it earlier on when I was talking about trying to get the sponsorship numbers up, and I think, crikey, how many meetings have I stood up and talked about sponsorship numbers? I've lost count. I really have lost count. And yet, then I think, Naeem, your feedback was, oh, someone didn't even know about it. So you've just got to keep going, haven't you? You think you've said it, and you think people have heard it, and it doesn't. It just takes so many times. So keep going. Let's keep going with the messaging. Keep encouraging people. And then finally, I'll come back right to where I started. As a finance function, we face a lot of challenges. We really do, which we always rise to. But it's been a really inspiring day. I suppose today reminds me how much actually the work we do through the Finance Academy, it still is integral to actually our day jobs and delivering that financial position or whatever your priority is in your day job. It absolutely overlaps. I heard Shona talking earlier on about the sustainability work, the overlap between the green agenda and how actually it can deliver efficiency, so that overlaps. And then finally, so much of it comes back to developing on our people and our teams. So we're nothing without our teams, without our finance staff. So anything we can do to develop, support, make it a more rewarding place to work, that's really invaluable. So that's what we need to do, and that's why I'm such a powerful supporter of the Regional Finance Academy. It's been wonderful. Pay real tribute to the work of Sheila and Stuart and the whole team, and all of you who actually make it work by getting involved. Thanks for your efforts, and I'm going to end it there. Yeah.
Did think there'd be questions.
No time for questions.
Hi, Steve. Thanks. I'm Kim Brum from Medway. Given the fantastic chart we saw earlier about the accreditation, different levels of engagement we see there, given the challenges that the NHS undoubtedly faces, and how pervasive accreditation sort of addresses some of those national priorities, what are your thoughts about either mandating accreditation or using it as a tool as part of the oversight framework?
Oh, that's a good question. I mean, from a sort of personal perspective, I always start from a place people have to want to do something. So I was a bit reluctant to go to the mandating stage. So I think for me, I'd always want to understand what are the barriers and the blockages. So start from that place. We've got it on our CFO agenda. It'll be on the next CFO agenda. What I hadn't quite realised until I saw that chart was actually how differential it is across different patches and systems. It was quite enlightening. It makes you think, well, what are the blockages in certain systems? That means, I think it was Sussex was mentioned, we had one at a level 3 and then no one else. It does more questions than answers. So I think for me, probably keen to get into the barriers and understand what are the barriers. I'm guessing again, it's back to that same theme we keep coming back to, time and commitment. And people see it as a bit too daunting. And actually, when you speak to people who've been through it, all you hear is A, it's very rewarding to go through the process, and B, the benefit pays back in spades in terms of those metrics we saw on that very slide. So I think not quite there on mandating yet, but I think it's certainly something to consider. But for me, I'm always more of a trying to work on the motivations and get people to want to do something than saying big stick. That sounds odd, it's coming from an NHS England person, but I'm not.
We won't tell anyone, Steve. Any other questions? Shona.
Thank you, Steve. I'm not going to ask you about funding for the workforce plan. I've got two questions. You talked about that, the professional judgment, and it's really quite difficult staying on the right side of the line. I just want to get your thoughts on how we all do that, because it's quite a challenging environment at the moment. And the other question is, with everything feeling really, really difficult, how do you think we best keep the energy and the enthusiasm and that kind of community in the finance group together to keep us going through this?
Yeah, that's quite a personal reflection I shared on that first point. So I've been doing this job for nearly 18 months now, and it's been my biggest single reflection is I think crikey, I mean, if you look closely enough, you see that deficit weighing on my shoulder. I really feel it, and I felt more exposed to the interface of government to NHS, poor Julian Kelly, how he does his job, I've no idea. He just is, amazing that he keeps sort of the good, because his style is actually really good, and when you deal with him, it feels a really fair conversation. You think, well, the amount of pressure he's under from government at the moment about NHS funding, it's significant. But naturally that translates down in terms of, we do get a lot of pressure as a regional team about, come on, you need to balance the books, you need to sort your performance out. And I'm the first to acknowledge a lot of that from a regulatory perspective just gets pushed down. So for me, in my values, I sometimes struggle with that aspect of the role in terms of how do you do that in a way that's respectful and fair. It's a real tension I find in my job. And I suppose I always try and come at it from the approach, well, let's treat people how you want to be treated yourself, and that's sort of my thinking when I do it. You can try and be tough on the issue. You've got to be recognising that there's someone sat the other side of the table who will be feeling exactly the same as I'm feeling, like under a huge amount of pressure, really struggling with the size of the deficit, and you've got there's just a human aspect where you've got to try and recognise that, and I think then it's just constantly try and reflect. Have I done that in an appropriate way? It's a fine line, as you say, Shona. So it's quite a personal judgment now, and I think that's half the battle, isn't it? Different people will approach that differently. It's quite a personal style thing, and I see that when I work across the other 7 regions. We all do it very differently, but I can only sort of reflect on how I lead myself, and hopefully in a way that sets an example for my team. The second bit of your question's gone clean out of my mind.
Keeping the enthusiasm and motivation when it's hard.
I think there's something about using the network. When we come together as a CFO group, I find it, you have these discussions where we're putting some really gloomy numbers up on the screen, but I think there's strength in the network, and we come together, and actually I think there's something about drawing on the fact that you're not alone in the situation. There's plenty of other people going through the same challenges, so I think draw on that network, draw on your peers who will be grappling with the same challenges, and take strength from it. I do. We've got 6 other regional finance directors up and down the country. Some days I wouldn't get through my job if it wasn't for those people who do that job. And you can just bounce ideas off them and say, well, how are you handling this? This has got a bit tricky, hasn't it? And it's just fantastic support network. So build your support network. It might be within your team, it might be someone in another team, and use that resilience to stay focused and positive. And again, do try and take some time to remember the successes we've had, because I think it's in the finance profession's nature to just move on to the next challenge and the next problem, and not always turn around and say, well, actually, we did a bloody good job on that, and actually, let's remember that, because we so often do. And financial year ends, we're on to the next year, and king is dead, long live the king. But actually, just take a moment to reflect on the successes we've had, because there's so many of them.
So, following on from that, I'm just curious, the amount of pressure you're under, and obviously other people here will be interested to know, how do you keep your resilience up?
Well, that's a good question. I think I've sort of partly answered it. So a lot of it is about just making sure I use the strength of the network I've got. I think a lot of it is then still trying to then, for me personally, and this won't work for everyone, it's very different for different people. I've discovered over the year. There's something about trying to, for me, it works to have that work and life demarcation. So, I might be rare, but I've just had a 2-week holiday. I don't look at my emails when I go on holiday. I do not look at them. I need to have that break. Otherwise, I just won't relax. I won't switch off. I'm checking my emails every night just to see I haven't missed anything urgent. So for me, that's quite important, keeping that work-life balance. And then at weekends, trying to make sure I have some downtime to, for me, it's cycling I like to do. So I do that. It just clears my head. So I wouldn't prescribe anything, because I think each person has their own way to get through stuff. But for me personally, there's something about clarity between work and home life that's quite important for me, and that's what keeps me sane.
Oh, no bloody pressure. It was a question that I posed on Slido, but the number of characters limits the nuance of the question. And I just wanted the sort of reflection of, I think the value of today is about the network. It is about sharing ideas and getting support. But what about how we extend that to our clinical colleagues who may be running into the challenges of balancing elective recovery with training clinical skills? And how do we take the lessons from here and spread those more widely?
Yes.
It was shorter on Slido.
No, it's a good question. I suppose, there's something thinking about the update from, I can't see Hannah, on the Future Focus, yes, the clinical educators bit. There's some links in there that we can draw through this particular work, but that's quite narrow in answering. I think more generally, because I notice this working with NHS England, we can be quite siloed, and the criticism I receive back about how we operate as a regional team is, yeah, fine, Steve, you're telling me this, but another part of your organisation has just told me that this is the priority and the money isn't so important, and get on with it and sort it. So I grapple with this problem on a daily basis. So it's for me, it's trying to make sure we are aligned when I speak to my medical director, my nursing director, and actually, and particularly my performance director, about the messaging. So something about close collaboration in those teams. I think then when you get down into organisation level, I think it's probably more about how you try and, I suppose, build those bridges between finance and clinical, and make sure we're doing that effectively. That, if I'm honest, I've been in the regulatory setting now for 10 years, but I did do a proper job before this, working in providers, and sometimes I reflect the bit I missed most of that environment was the reality of connecting what you were doing to the service. And sometimes you don't get that in the role I'm doing. You get it to an extent, but you don't get it to the same sort of basic level you get it when you're working in a hospital environment. So that's the bit that I always found most enjoyable working in a provider finance setting, was actually connecting with clinical folk. Because that, as ever in finance, our challenge is that we don't really spend the money, do we? We account for it, but we're not people spending it. And it's about getting people's buy-in, recognising their decisions have consequences. It's the most important part of the job, and I think within trusts, within ICBs, that's the job, is to try and connect those conversations and make sure it happens on a daily basis. Thank you.
Can I ask you to put your hands together for Steve, please?
Thank you.
I'm really conscious of time, so I was just going to suggest we have a quick 5-minute break and then we'll bring Matt on, if that's okay. I'm looking at Stuart for him to nod. Yes, that's what I thought. Yeah. 5 minutes and we're back in the room for 1:45.
Ellison to the room. So he's our motivational speaker for today. So please can you put your hands together for Matt, and I'm going to hand over to him.
Brilliant, thank you. Hello, can you all hear me okay? Yeah? No? I said, can you see people go, no, they can't. Just wondering if you can hear me. Real pleasure to be here. Happy anniversary, because I understand this is the first anniversary of your academy. You call it an academy, yeah? So well done with that. But yeah, always a pleasure to be here, so I hope you're having a good day. As you know, I'm Matt, and in a moment, just make sure my timing is right, I'm going to share with you my story. But before I do, I just want to ask you all a question. How many of you have been in a crowded room and yet still felt alone? Now, obviously, yeah, I don't necessarily need an answer right now, but I see, sadly, some hands going up. I'm sure some of you will have had that experience yourselves, or you'll at least know what it is I'm talking about when I ask that question. And the reason I ask it is because I speak to lots of companies and organisations about diversity and inclusion, change, resilience, bringing your whole self to work, etc., etc. And there's some amazing work being done. It's really, really heartwarming. But, it's always a but, I do feel that sometimes we haven't got to the end point. And what I mean by that is just inviting someone to the party doesn't necessarily give them a sense of belonging. And I don't feel till you've achieved that, you've got where you need to be. But I'm going to come back to that because, as you know, I'm here to share my story, which is that I'm transgender. I'm sure you probably already know that. Now, I have had some people say to me that they don't think, oh, I'm going to make, I've got the same problem. I didn't even touch it. There's a force in the room. I have had some people come to me and say that they don't think I'm going to make a very convincing woman, which I find quite amusing, quite entertaining, because, yeah, I've been there, done that, bought a T-shirt, and it really didn't work. I am what they call, there's different ways of describing it, but I describe myself as FTM, so that's female to male. So that means I was born physically female, but psychologically male, and I've transitioned to bring my body in line with how I feel inside. So first off, what I think is a really, really important question is what actually is transition? Because there's still some people that sort of think, oh, it's the op, you know, it's an operation. And yeah, you know, most of the time, but not always, it can take surgery or hormones and stuff like that. But actually the essence of gender transition is actually just living as your psychological self. So the surgery and stuff is just part of that. So that very often means changing your name and your identity. Clothing can be very different between men and women. Socialisation, so if you take a very stereotypical evening of, say, a stag night and a hen night, you can get two very different sets of behaviours. And then possibly, but I say not everyone can or wants to go down this route, changing your body through hormones and or surgery. So for me, what was my early life like? It was really difficult. But I'm about to show you some pictures. Please feel free to laugh at my long hair. I did used to have long hair. I was joking, no. So yeah, I did used to have long hair. Not my choice, obviously. As soon as I was old enough to have any say in that, the long hair went. And then what I've done here is, obviously there's not enough time to go through everything that's sort of out of sorts with my life. So I've just picked out what I think are some important or main key points. So the first one around age. I would say I was probably 3 or 4 years old at the first signs that there was any sort of gender issues going on. Obviously, I don't know, I wasn't keeping a diary at that age, but the first one that I can definitely pinpoint an age on, and it was by no means the beginning of this, I was 5 years old. And there was something I thought would happen on my 6th birthday. I mentioned and said this to my family, and the looks that I got back, I just knew in that moment that this was not a good thing. It was not going to be accepted. I couldn't do anything or act on this. So I literally shut up about this and swore that I was going to take this problem to my grave. Now, 5 years old, that's a really young age to be carrying something quite so heavy with no help, no support, you know, no one on my side, no access to information. I knew it was a thing, but I didn't know how many people were out there, what could be done. I didn't know anything about hormones. That was really important for me. So I lived my life struggling, basically, from the age of 3, 4 years old. I literally used to cry myself to sleep at night. I prayed that when I woke up I'd be a boy. So can you imagine my disappointment? Like almost every morning waking up, looking under the covers and being like, nope, still a girl. I literally wished I'd not been born. I'm glad I didn't have the courage to do anything about that because I'm still here. But yeah, if I could have turned the clock back and had a choice, I'd have just said, don't have me, don't bring me into the world. always asking why me. And of course, back then, there was no internet. So, like I say, I had no access to information. I didn't know what could be done. I didn't know how many people there were out there. So, you know, really young and struggling with no help and no support. Here's a picture of me living the wrong life, very definitely, at age 16. I'll just let you process that a little bit. So, I used to be a police cadet, and I was only given one uniform, and it had to be a skirt. So I had to walk the streets with other police officers looking like that. And I have had someone come up to me, which is actually an NHS event as well, and say to me, wow, that picture was horrific, which would normally be quite a rude thing to say. You know, when that picture was taken, I just got my uniform, just started out, I was proud of that. I wanted to be a police officer. But it's actually quite apt. You know, you've met Matt for a few minutes now, and I'm sure you probably look at that and think it looks a bit odd, which it does. But the reason I show it is because, for me, that was my normal. That was my life. My whole life revolved around doing things and saying, you know, having to live this life that just wasn't right and wasn't me, and that most people just don't have to experience that. There's another picture of me in another skirt. So I started school in '79, and back then, unlike now, obviously, girls weren't allowed to wear trousers to school, so I was stuck in a skirt again. And that one is Freddie Mercury, believe it or not, which I guess that's me living out my childhood fantasies. It's a fancy dress. I'm going to pick a male character. So I picked Freddie Mercury, and I remember having so much fun putting that tash on. It wasn't a joke one. I went to an acting shop in London, real human hair on a mesh, and glued it on, and had great fun. And look, I'm so proud because I can, thanks to hormones, I grow my own now, which is pretty cool, and it looks more realistic. So again, just a few little points. So there's not enough time to cover everything. So toys, some of these are just things that people go, wow, I'd not considered that. I asked for several boys' toys growing up, like an Action Man and stuff like that. I never, ever, ever got them. And, yeah, it's only playing, but playing is a really important part of our development. I'm sure, you work in the NHS, you're probably aware of like Erickson's life stages and stuff like that, and how things that affect us can actually psychologically have a lot of impact going forward on our lives. So, think of a tiger playing, that's how they learn to hunt and feed themselves. So we've got development, physical development, we've also got finding our space with our peers, and when you're not quite, you're having to suppress yourself and you can't do the things you want to do, not for everyone, but that can be quite damaging and, permanently. And then clothes. This was a huge one for me. I had several coping mechanisms in place whereby I'd wear clothes that I wouldn't say I felt comfortable in, but that I could survive in, that I felt least uncomfortable. So that was for me jeans and a t-shirt because it was very androgynous and unisex. And there was no way, once I'd got out of the police cadet uniform and my school skirts, etc., that I was going to go and choose to wear smart women's office clothes, because obviously as clothes tend to get smarter, they tend to get more gendered, and go and work in an office environment or something, like where we are now. I couldn't have done it. And so that limited, we spend a lot of our time at work. So that completely changed my life and my career path. A lot of our lives and our week and our days are at work. But it also then affected my income and therefore my standard of living, just because I couldn't wear the clothes that I felt comfortable in. And this is one of those things that, people say to me, well, I've never even considered that, because obviously if you don't have to face those challenges, why would you? You're not even going to think about it. But, and again, this is just one of many that affects your life when you're living the wrong life, basically. And everything I say, there's parallels to all walks of life. It's not just applicable to the transgender community. There's lots of minorities that have issues that are similar to this. So I had a fear of the body changes that were coming my way. I knew that my body was going to go breasts, and the thought of that scared the life out of me. And when it did, I had so much dysphoria about the shape of my chest. It could be the hottest day in summer, and I'd be there in a big baggy jumper, like this, trying not to let people see, because I just couldn't stand the thought of anybody else seeing this feminine shape on my chest. So, that was really uncomfortable and not very pleasant. And then puberty, having gone through two of them now, the second one being much nicer for me anyway, I think puberty can be a really difficult time for many adolescents. But can you imagine how it feels when your body just goes in the complete opposite direction to the one you feel it should be going in? And yet, it's difficult for some people, but we're all going through it. But for me, I was watching 50% of the people around me going through and experiencing those changes that I yearned for, the voice breaking, growing facial hair, body hair, more muscle, etc. So it's a really, really difficult time. And that's like Groundhog Day, because it wasn't just, you know, the people at my age. As I got older, younger people coming up, it felt like they were overtaking me in life. And it never, ever stopped, you know, right into my nearly 40. So again, another question. Why did I wait so long? I was 39 when I started transition. Fear, basically. Would my friends and family reject me? Now, you might say, well, you'll find out who your friends are. And yeah, to some degree, that's obviously true. But what if it's your really close friends? That's going to hurt. You need that support. What if it's your parents or your family? There's apparently a 93% reduction in suicide risk for a trans person if their parents are supportive. So that's not nothing, 93%. So, you know, we need support, basically. Would my business fall apart? I'm self-employed, and I've already spoken a little bit about how my income has been affected by this. Would that get even worse when all my clients decide to run away because they think, you know, there's something really odd here? But really importantly, would I be threatened? So we know that there's people on this planet that would harm me, whether that's beat me up or possibly even want to murder me just because I'm transgender. And they know nothing about me. It's really quite scary. So again, just, you know, huge considerations before making a decision to go forward and make this, you know, start this journey. But I do have to say that becoming the real me has just been the most life-affirming, amazing journey you could ever imagine. It's absolutely brilliant. So I don't have to pretend anymore. I'm just me, which is incredible. I can wear the clothes that I feel comfortable in, and I love dressing smartly now, despite the trainers. That's for comfort. And I've seen hormones and surgery change my body in ways that I just literally didn't think was possible. I kind of liken this to bringing someone back from the dead. You know, it's just not possible. And that's what I thought this was, because I didn't have that access to information to know what was possible. So here's a comparison picture. On the left, that's obviously pre-hormones. And on the right, probably about 1.5 years, 2 years into transition. And what I need to point out is that on the left, that's not through lack of trying. I was a sporty child. I competed nationally in judo. Used to go to the gym, try and get muscles, and it just wasn't happening. And on the right, that's not any abuse of steroids or, you know, anabolic steroids or anything like that. That's normal male level testosterone going through my system. Yes, I go to the gym, but, you know, it wasn't possible without the hormones. And if you're a trans woman, the opposite happens. So you lose all that muscle mass, you lose strength. Body fat redistributes and you become more curvy and more feminine, etc. But if you have a look, you know, look at the V shape of my back, look at the muscle mass on my back, on my shoulders, on my neck. Even the back of my head has changed shape. You know, and that's all just hormones, which is incredible. So, you know, imagine how I felt growing up with just the wrong body completely, how I feel now when I see that. It's just, you know, I'll never ever tire of what medical science enables us to be able to do. It's incredible. It changes lives. There's me from the front, and I'm not showing you it before, obviously, for obvious reasons. Now, you can see there, but you can't see them. They're more clear in real life. I've got scars from armpit to armpit from my chest surgery. And yeah, I'd rather not have them, but with the dysphoria that I had before, can you imagine how I feel when I look in the mirror and see that? Which is actually why I have to refuse the cake, because it doesn't look like that at the moment. 3 years since COVID, I've been trying to get that flat tummy back, and it's not happening, and it just gets harder. I'm nearly 50 now. But like I say, it's just incredible. I've got pictures to prove I did used to look like that. But as I said, it's not just about the physical side of things. Yes, that's really, really important, and I hope I've got that across to you and how amazing it is. But the fact that I now feel comfortable in my skin, that's what makes me inside develop as a person. So, you know, the changes are still kind of happening, but they've slowed right down now. I've been on hormones for about 10 years now, nearly. But because of those changes, I'm growing in confidence inside, and that growth is still happening. It's amazing. It's incredible. I'm just much happier, much more productive. So, you know, just to be able to be me, that's what that's enabled me to do. And it's, you know, I've gone on to then do some incredible things. So there's another picture of me looking a lot more comfortable in my skin, not hiding under a big jumper, but in a vest. When I was doing more gym work, I've got a frozen shoulder at the moment. That is very pleasant. But like I say, it's enabled me to go on and do some incredible things. So I co-chaired a support group, FTM London. So that's FTM's female to male. which is where I went for support and help. And it was a real privilege to sort of pay it forward, if you like. We'd get doctors, endocrinologists, surgeons in, and counsellors, and it just enabled the trans men coming up underneath me to embark on their journey and get their questions answered, which was a privilege. I've engaged with NHS England, that's quite a long time ago, about improving trans care, because I'm sure you're probably aware there's lots of improvement still needed. I'm sure in all areas of NHS, but that's definitely one of them. I mentor vulnerable trans individuals and appeared on Channel 4 documentary, which was pretty cool, and speak to lovely people like yourself. So thank you for listening. But, I say, there's always a but. There is still so much work to be done. And what I've done here is I've kind of put this into what I consider the three main groups of people that cause us problems. There's a bit of overlap, but obviously, to me, these are the three main groups. So you've got opponents. So these are just people that, for whatever reason, are just against us or any minority. I say it didn't have to be trans people. I don't even like looking at this guy's face. Donald Trump thinks I should use a ladies' toilet. I don't know about you, but if I came up to any one of you, if you hadn't seen my talk and didn't know who I was, and said, "Oh, excuse me, do you know where the nearest toilet is?" I'd like to think that you'd post me to the gents and not the ladies. And he knows this. He's not stupid, and he just plays on it, and he's just not a nice person, basically. So, you've got a group of opponents. And then you've got the unthinking, and this is something that happened to me. My old Facebook page was closed down under their real names policy. So you might say, oh, it's only Facebook, it's not that important. But social media can play a huge role in people's lives. It certainly does mine. There's no warning, you can't speak to them, it's just boom, gone. So that's all my memories gone. My wall with all my comments, pictures, photos, my contacts on there. Some of them I hadn't told yet. Coming out isn't just a one-off event, I'm still doing it 10 years later. So hence why I didn't want to put a male or female name on there, and that's why I got caught in that little loop. But some of those contacts I've made maybe from school, I'll never see them again. I may not need to explain to them, but it just, I felt quite depressed when that happened. And then you've got the ignorant, and what I mean by this group of people is that not that the people are ignorant, far, far from it, but that they're uneducated on this particular topic. Now, there's just a warning, a trigger warning here. There's many, many examples of this. This one happens to be an NHS example, but I'm not throwing the knife at the NHS. It just happens to be the example I use. So a good friend of mine, early on in his journey, was called up by his GP. He was trying to organise his care. And his GP said to him, I'm not going to prescribe you hormones because I won't let you be responsible for ruining my career when you get cancer and die. Now, I will never, ever get over how a GP can say that to a patient. So, I'm sure everyone in the room probably thinks, that is so unethical. So, first off, a big thumbs down. But the double whammy here is that obviously that's not even true. So I did, just to unpick that a little bit, I did a lot of research coming into this because I didn't want to shorten my life or take any risks by transitioning. So hormones in themselves don't cause cancer. We all know that there's many drugs that are prescribed that have massive side effects, chemo for example, but the benefits outweigh those side effects. So hormones aren't even one of those. The side effects are puberty and maybe a few spots, of which I had many. The right puberty, hopefully. But to take that even further, they don't cause cancer. Your body just responds. You've got both hormones in your system, whichever it gets, predominantly male or female, it will respond and just react to that. But to just take that further, what I kind of figured out for myself is that actually a lot of the cancer, our cancer risks are reduced because a lot of the cancers that we as humans suffer from are gender specific. So you've got testicular, prostate, breast, and cervical cancer. And yet as a trans person, we very often have bits of or all or parts of those organs removed, which reduce those risks. And yet we cannot get the cancers of the opposite gender because we don't have those organs. So me, for example, my breast cancer risk would have been in line with the average female, but we've had not all, but maybe 80% of my breast tissue removed. So that risk has gone massively down, and yet I can't get prostate cancer. So, basically the point of that is that that was a medical professional that had their medical facts incorrect. And this is something, I've had actually, after some NHS talks, people go, I don't believe that there's that much hate or that much ignorance. But, I'm in the community and I see it all the time again and again and again. It's actually quite scary what the transgender community faces with their GPs. It's a bit of a lottery. My current GP is absolutely incredible, but I did have to change GPs because my first one wasn't. So, you know, it is difficult, basically. But just taking this on a little bit further, this is Dr. Stuart Lorimer, and some of you may have heard of him. He's one of the good guys. I think he used to work at Charing Cross Gender Clinic. I think he's moved on now. But he's one of the UK's leading gender specialists, and he's a psychiatrist. And he was interviewed by Huffington Post. And what he said, that this is an optimistic field because people get better. So he said 99% of the time, people leave feeling less gender dysphoric. And he says that's really rare in psychiatry. So, you know, what does that tell you? What it says to me, anyway, is that actually being transgender, or let's say any minority really, isn't the issue. You know, we can treat, I'd say I don't like my scars, but I'm so much happier with them than what I had before. So we can make lives better, basically. It's so easy with treatment. So where do the issues come from? What was it that stopped me transitioning? What was it that was making me unhappy in my old self? It was those people around us. So those antagonists, those groups of people, fear of being beaten up, losing clients, etc., losing my family and friends. You know, it's always the people around us. It's not being the minority itself. So he goes on to say that patients battle with parental denial, reluctance from medical practitioners to prescribe, and I went through that myself, that was tough, and ignorance in the workplace, which is where I have to say to all of you here and the organisers, thank you very much. You know, huge take. It didn't have to be me, but just by listening to these lived experiences and having a slightly better understanding, that is, you know, that's educating those around us, which then makes our lives easier. So thank you so, so much. You know, it's more about you than me, which is great. So on to a few other little bits and bobs. I bet you didn't realise there's gay Lego out there, did you? There is. I love that picture. Sexuality. Just want to mention this because quite a few people have said to me, oh, okay, so you're trans. What does that make you? And it's like, well, it doesn't make me anything. In the same way as a non-trans person or cis person can be gay, straight, bisexual, pansexual, all the different orientations, so can a trans person. So just something to mention there to help with some of the confusion. And then problems. Like I say, I hope every single one of these points resonates with some of you on, you know, different minorities or, you know, different groups of people. But this one in particular, I literally used to think, I felt very hard done by. I used to think that every single problem in my life stemmed back to being transgender. And actually, now I'm happier and comfortable in my life, and I've taken a step back, which means I can see a bigger picture and things a bit clearer. I found that, obviously, yeah, we all have problems, but that we all have similar or possibly even the exact same problems, but for completely different reasons. Here's a really good example. I do kickboxing, and I've been training with someone for about a year before one evening I suddenly thought, hang on a minute, we know each other. And yet we'd known each other from about 20 years previously. Now, something that I thought was exclusive to me, obviously I've changed my identity, that's why he didn't know who I was. But it's not just me, you know, it's not just me that experiences that. So I didn't recognise him, not because he was trans, of course, because he wasn't, but because he'd had a massive weight loss. And in fact, he probably looked physically more different than I did. So like I say, exact same problem, but for a completely different reason. And it's very easy to feel hard done by because you own, you know, the grass always looks greener. So yeah, just a few life lessons there. But it was really, really funny. You know, one of those situations where you're not 100% sure, you don't want to say the wrong thing and make a fool of yourself. So I kind of asked him a few questions. And he'd obviously been thinking it because the look of recognition in his face was just classic. He literally, I remember he's pointing two fingers at me, bending his knees and going, I thought I knew you, but wait for it, because he looked a bit confused and hesitated and paused and went, have you got a sister? This was in front of my kickboxing class, which actually I'm not out to. So most of the people in that class do not know I'm trans. So I'm like, oh. And this is somewhere like, you know, sometimes I'm asked to expand a bit more on the resilience. So this again is one example. Can you imagine how it would have been very easy for me to now think, now my whole class just know my background. But actually, again, what I've learned in this journey is that we can, everything that's thrown at me, I can just take stuff in my stride now because there's always a way out, there's always a way through it, and we always, you know, panic about these things. So, you know, if you think, who would have heard that? It was a busy kickboxing class, not many. And even if they did, would they have made that connection? Probably not. And even if they maybe thought it, they'd think, nah, because I passed so well, etc. So yeah, you know, there's always ways around these things. So then on to change, and these are just a few of the points that I've learned having made one of the biggest fundamental changes a person can make, basically, changing my identity. We all know how important change is. You know, you need to make change to improve things, or if you've got competitors to keep up with them, etc. Sometimes it's thrown on us, so it's something that we have to cope with when we didn't ask for it. But you know, say these are just my life lessons, if you like. So the first one, which I think is really important to consider, is that at the age of 5, I built that wall, that barrier around me to protect myself, and I swore I was going to not do anything about this. But actually, like I say, when you don't take a step back and you can't see things clearly, all that did was it, you know, protected me to some degree, but it stopped me seeing over. So yeah, we've still got a lot of work to be done, but the world has changed a lot since the 70s, and I couldn't see that literally because I just shied away from anything trans. So again, you know, it's a life lesson, but change is normally scary because there's risk involved. We don't know what's going to happen. We could make things worse, and so there's always fear. Fear is obviously there for a good reason, because if there wasn't, you'd go and do stupid things. So, you know, it's there, but we do tend to focus on bad, you know, worst case scenario. So to me, what I found out was that actually fear and understanding are kind of inversely proportionate. So what I mean by that is that the more you can educate yourself and go out and research a particular topic, you understand the consequences better, you can move forward knowing that that's the right decision for you. So this to me is all about the therapeutic moment. So I've done a little bit of counselling. I'm sure some of you may have, you know, maybe know a little bit about stuff like this, but I remember my therapeutic moment so clearly. So it's that moment where all of a sudden you can see things clearly. So it's like the light being turned on. And it was my first session with my gender specialist, and they said one thing to me, one sentence, that completely dissipated, like nearly 40 years of fear. And what that was, well, one day people will come into your life and they'd have only ever known you as Matt. And that was it. That did it for me. So you might be thinking, well, what's so significant? So I'll explain. Remember I said that my fear was all the people around me. So I was looking at all these people that I knew, which as I was going on in life, obviously you meet more people through your career and hobbies and stuff. And I'm thinking, God, you know, my deepest, I couldn't know, they can't know. And I couldn't. And like I say, coming out isn't just a one-off event. And it's not as simple as just telling people. What about, you know, again, if you've not had to go through this, you wouldn't consider this. But what about your local supermarket, the checkout people that you chat and stop and have a little conversation with? You can't sit them down separately and have a word with them, and yet they're going to see you changing. How do you deal with these things? You know, waiters in your favourite restaurant, etc. It's so complicated. And I was just sitting there thinking, I can't do this. And the minute my counsellor said that to me, I realised, hang on a minute, if I'd done this at like 18, 19, 20, all these people I've met since then, they'd have only ever known Matt, and life would be great. And those that knew me before, it's yesterday's news. So I realised I was living in that moment of having to tell people and not looking beyond it. So, you know, but I do firmly believe, that's just one example, that anyone can find their therapeutic moment if they need to make change. Which, you know, I moved forward. Yeah, there was fears, but with confidence. So then on to D&I and why this is so important. Again, it's just my insight into this. But, you know, to me, what this comes down to is there's two groups of people that benefit from inclusion. So you've got those being included, like myself, and that's obvious. That's why that would help me. But also those, you know, those doing the including. So I'll come back to group 2 in a moment, but they come together and make a great team. So to me, what this comes down to is commonalities and differences. We all know why we need differences on a team. You know, the stronger skill set you have on a team, the stronger that team will be. But commonalities is so important, and this is where I've seen some great work. You can look this up on YouTube, but I was actually at a conference, sat at the back witnessing this, and it went on for about 45 minutes, whereby you try and find out who's got things in common. So you might say, oh, you know, whose favourite colour is blue? And they were going, oh, that's me. And they were having great fun being able to come out the front. And it's basically kind of putting people in a box. And outwardly, they may not look like they've got anything in common. So you might have a man and a woman, someone who's tall, someone who's short, white skin, black skin, might be different minorities, you know, different languages. It doesn't matter what it is. But inwardly, there's something in common, even if it doesn't look like it. And you can ask any question from, you know, who's been on holiday this year? Who's, you know, going to go away for a weekend, who likes cats, who likes dogs, etc. To really heavy questions, which can actually be more powerful. So, you know, who's lost a loved one recently and things like that. Or who survived COVID, you know, who's lived through COVID. That's something we've all got in common. So this went on, and I'm thinking, wow, this is really, really great. You know, this is so important to find these commonalities. But they never got to the punchline. It wasn't being explained why. They had so much fun doing this exercise, and I'm sitting there thinking, I know what it is, but it just wasn't said. So to me, this is what it all comes down to. You've been invited to the party, metaphorically, obviously. It could be an office, it could be here now. But you don't really feel like you've got much in common with anyone. And I've been there myself, literally, where so you're just sat in the corner, you're not speaking to anyone, and you know, you're feeling a bit alone. But someone comes up and starts talking to you, and you strike up a conversation, and you realise that, yeah, maybe you support the same football team, and they played last night, it was on TV, and you go, oh, wasn't that match great? Yeah. Oh, and that goal, it was amazing, wasn't it? The second that conversation happens like that, for that person that felt alone, that's when they get their sense of belonging. And that's why that's so important. And we've lost some of this. You know, I've been in jobs years ago where you couldn't even have a coffee break. It was all just, no, work. And that's, you know, a terrible environment because, yeah, we all need to be productive and work, but you need that bond with your colleagues because if you feel comfortable and happy and you want to go and talk about last night's football match, you're then going to be much happier and do more work as well. So, you know, and we've lost some of that through COVID, I think, with online meetings and stuff like that. But it's so, so important. So then group 2, you know, I'd like to think that you'd much rather, if I was going to come and work for you, you know, as a colleague, that for any one of you anyway, that you'd much rather have me as Matt than me before. Because I'm happier, I'm just going to be much more productive. And that's going to rub off on my team around me as well. And also, word gets out, so then you get more people wanting to come and work for you, which means you've got more skill sets to choose from, making a strong team, your team stronger, etc. But also patience. There's something I want to mention here as well. Some of the forums I'm in, I think there's one that's got about, this is all trans men, so obviously 50% or less of the trans community, but I'm in one forum that's got about 3,000 people in it and one with 2,000 people. And one of the things that gets asked a lot, and there's lists on there, is, you know, where are your friendly GPs, which GPs to avoid, which surgeries to avoid, etc., and which ones to go to, because this is something that, you know, again, people don't realise that. They go, oh, I don't really believe that happens, but it does, you know. So if word gets out that you're a nice friendly GP practice or that your company is whatever, it helps everyone basically. Then again, onto a few other little bits and bobs. It's not a transgender frog. This is my favourite slide. I absolutely love this frog. A tiny, tiny little frog in a big, big hand. And what this represents to me is how something very small can make a big impact. So it's all about little frogs. So this is, it covers, oh, I've just pressed the button. How do I get back? Let me see if I can. There we go. Let's just check my thing. Yeah, clicker's still working. Phew. I will avoid that again. So this covers how to say the right things to people, how to say not to say the wrong things, how to be an ally, how to start difficult conversations. I quite often get asked, okay, yeah, we want to educate ourselves on D&I, but we don't know enough, and we're really scared we're going to say the wrong things and upset someone, so we can't actually get started. So my example for this is I've got a bad back and I see a chiropractor, and I hadn't been for a couple of years, needed to go. Post-transition that was. So I phoned up, explained to the reception and said, you know, change my name, blah, blah, blah. So they've changed everything. I've gone along to the appointment. I'm sat in the waiting room waiting to go in. Now, yeah, put yourself in my shoes. Imagine how I feel in that moment. I haven't spoken to the man himself. I've spoken to his staff. Known him for a long time. No idea if he's going to be on side, clued up, you know, mess up by accident, on purpose, not like it, whatever. Mess up in front of people in the waiting area and out me, etc. So it's quite a big moment. Bit worried. He didn't. He got it all right. He called me Matt, called me and closed the door. So I was like, oh, phew, first hurdle over. Then one of the first questions he asked me was, have you been binding? Now that's when trans men pre-surgery, and I wish I'd known about this because it would have made me feel much more comfortable, they'll bind their chest with garments or bandages to flatten it and make it appear more male before their chest surgery. But especially, you know, the amount of time that trans men are waiting for surgery, if they're binding tightly and over a prolonged period of time, what that can do is it damages your lungs and your ribs and can your back as well. So what's, essentially a bit of a weird question, a personal question, was really apt for a chiropractor to know to ask that question about how my back would have been affected. So what did that do to me in that moment? I'm like, oh, okay, so he knows about this stuff. He's on my side, but ultimately, this is a man I can trust. What I then immediately went on to find out was that that was literally all he knew. He didn't know anything else. So this is what I mean. That was a tiny little frog. It was nothing, and yet to me it was massive. So from then on, if he says something or asks something or says it wrong, I'll just correct him, and I know there's no malice. If he'd got it wrong by accident even, when I was still in the waiting room, before that little frog, I would have reacted quite prickly and it would have been a completely different situation. So basically, it's obvious. You don't have to know everything. You can't know everything, and what's right for one person to say to them might upset someone else. So you can't always get it right. But if you've demonstrated a little frog, you don't need to know a lot or all. It carries a lot less weight, and it gives you that license to then start those conversations, because that person knows it's coming from a place of good and not from malice. And there's many, many examples of little frogs. So here's another. I did a Stranger Things Secret Cinema, which is an amazing event. If you ever get a chance to do one of these, it's a company they get actors in, and they dress them up like the characters in the TV series or the film, and you go along, and you could get to interact with them and do quizzes and stuff like that. So you feel like you're part of it. It's an amazing experience. So obviously, because it's fancy dress and you have to have a character which would be gendered. So they need to ask you certain questions to give you your character before you go. Now this is a screenshot from their website. Their gender options were male, female, other, and rather not say. Now I personally identify as male 100%, so I tick the male box. But the fact that it said other, which was much smaller than that circle on that screen, that tiny little frog, that was the frog for me. It was just this little thing, and yet it meant when I went to the event in person, I knew that I was dealing with a company where I was safe because they understood these things. So that was the hand for me basically. If I go anywhere and there's gender-neutral toilets, that's always a big indicator. Obviously, you can't go pulling infrastructure out necessarily, but if you're planning a building out, then please, please, please consider that as an option. And then pronouns. So again, these are just little frogs to me. They're words. So lots of people think, oh, they're only words, man up, snowflake, etc., etc. But for the person saying it, yeah, it's just a little word. But for people like us receiving it, think of all the things I've said in my life that were out of sorts. And again, I'm sure you know how depression can build and mental health issues, because you could put up with stress for a little bit of time, but when you're dealing with this day in, day out, and your whole life from toys, clothes, career out of sorts, people saying the wrong things, just looking in the mirror and seeing the wrong body, that builds and builds and builds and builds and becomes really, really difficult. You can get more and more depressed. So when someone then uses the wrong pronoun or uses a dead name, a previous name, etc., it's like having this open wound and sticking a knife in it and just jiggling it about. So for us, it's massive. But for the person saying it, it's just a tiny little word, that's all it is. And that goes for anything. This is why inclusive language for any minority or any person, whether it's through disability or, your background or your gender identity, sexuality, anything, to just use the right language has a huge impact on those people. And then I just wanted to talk a little bit about non-binary, because I know this can confuse a lot of people. So one of the things I see a lot, particularly online, is gender-neutral pronouns. They're plural. You can't use them for singular. But not only can you, I'm guessing most of the people in this room will have at some point. So here's just an example, just to show that, to give some confidence, hopefully. Here's a painting, and we like it, but we don't know if the artist was male or female. So you might go, oh, wow, look at this painting. Haven't they done a great job? So we've said they, because we didn't know whether to say he or she. So we've probably all done that at some point. And again, like I said, I just wanted to mention it, because if now that, having seen that, it just gives one person in the room or online the confidence to use that pronoun in the correct context for someone, you really, really can make their day. So going even further, this I find absolutely fascinating. And I feel like I'm probably preaching to the converted here, because, you are NHS, but I'm going to say it anyway. So not even biological sex is binary. I'm sure we all know about XY and XX being the main chromosomes, but there's different combinations, including the one I find most fascinating is XY androgen insensitivity, which covers even, from very mild, so that's where a male chromosomal person has an insensitivity to testosterone. So that might show up a little bit at puberty, they might have a little bit more like girly hips or something like that. But in its extreme form, apparently, I find this fascinating, they don't respond to testosterone in the womb, so they don't grow male genitals. So they're born physically female, and yet their chromosomes are actually male. So it's really interesting, but you can look these up on Wikipedia if you don't know about these. But the reason I explained about these is because what I find fascinating, if you imagine if the human body has that much of a capacity to be somewhere on the scale between two genders, imagine how amazing are our brains. It's incredible. And talking about the spectrum as well, I should have said this bit first. I see a lot of people go, oh, there are only two genders, that's it, it's black and white. And it's like, well, okay, that's the truth, but not the whole truth. So if we take the black and white example, 2 pots of paint, yeah, we've only got 2 colours, but if you mix them, you get any shade of grey, millions of them. You try mixing the same shade twice, you'll never get them. And that's what the spectrum is. It's about being somewhere on that spectrum. And I find it fascinating that the world's accepted, even the haters know that this is a thing, that we get men that can be very masculine or can be very camp and effeminate. We get women that can be very feminine or can be very butch and G.I. Jane. And yet, say we've accepted that, so why can't we get someone that just sits somewhere in the middle that maybe feels like a bit of both or feels like neither, or more one, changing from day to day like we change our clothes. So, I think the reason people don't get this is because if you don't experience it, how can you imagine what it feels like? But obviously for the people who do feel like that, it's very real for them. So they just deserve some respect. So here's some example of gender neutral pronouns, they, them, theirs. And it's also another little frog, because if I get an email signature with pronouns in it, again, I know I'm speaking to a person that's on my side. It's like, yeah, okay, I'm safe here. And it doesn't have to be gender neutral. You might find, you quite often see people as a man and they've got he in their pronouns or a badge or something, and people go, oh, but I know you're a man. Why do you say he? And this is why. It's just sending a little frog. It's just a little signal. It's something very little that we can do that actually makes a big, big, big difference to someone that reads it. That's an example of a gender neutral title. If you ever see that, there's quite a few of them, but MX, that's what that means. And then just one more thing. I'd like to think that incorrectly, if you like, judged my book by its cover. And what I mean by that is, you look at me, I look like Matt, I sound like Matt. You looked at my police cadet uniform, I thought, well, that looks a bit odd. And so you've got me. You know that I was born female, but you think, yeah, you're better as Matt, you're a happier person, that's great. But I kind of play on this fact because it's not about passing. I use that as a tool to get through to people because people understand that. But if you imagine, I passed pretty well before hormones, but not everyone does. So, and I didn't fully, obviously, before hormones. I didn't have any facial hair, my voice hadn't broken, etc. So before hormones, I was still the same person. I was still Matt. And yet I looked different. And for some reason, we understand what we can see, and we don't understand what we can't see. So basically, if you understand me, there's some people that either don't want to take hormones, haven't got there yet because it takes a long time to go through the process, or maybe they've gone through the wrong puberty and the cards they were dealt will just mean they'll never pass. But what's going on inside their heads is exactly the same as for me, and they deserve the same respect. Some people may not want to transition, like physically, and why should they? It's about improving life, not necessarily making it perfect. So if a person can wear the clothes that makes them feel comfortable and it alleviates their dysphoria, let them. But the reason a lot of trans people can't do that is because people go, but you look one gender and you're wearing the other, and they think it looks weird, and then they get bullied and harassed and beaten up, etc. And that's what stops them doing it and feeling better. So, it's basically don't judge the book by the cover. And if you can do that and allow someone to be themselves, then again, you can really give that person their sense of belonging. If they can come to work feeling and dressing how they want to, that's fantastic, and they're going to be more productive, and it really can make a difference. So, without further ado, on to some questions. But before we do, I just want to say thank you very much to everyone here, the organisers, those at home. But also, please ask me anything. There's certain things you don't ask trans people. This is your opportunity, because I'm quite happy to say I'm not answering and explain why. And I have been asked some very weird questions before, so.
Hi, Matt.
Hello.
One of my daughter's school friends is transitioning at the moment. So are you going into schools delivering talks at all?
I have done, not so. I've done a couple of schools. I've done a school conference. So yeah, I kind of do that. But quite often as a speaker, they don't always have the budget, and it's really difficult because I also do big corporations, and then if you're doing this for them and they're not this way, it makes it really difficult. But yes, I do schools and stuff like that, yeah. In fact, just going a little bit further, that was what started me on my journey, because I kind of said to myself, if someone had come in and given my talk when I was at school, it could have changed my life, because it's that representation and that understanding. So I thought I wanted to go and do that for others. So that's actually where this all started.
Hi, Matt. Thank you for that talk, and I guess congratulations on facing your fear and having the courage after 39 years to live your authentic life.
Yeah.
I wanted to ask, this is probably going to put me in your ignorant box, but I understand sex is biological and gender is more of a societal construct, as it were. To what extent is stereotypical sort of genderisation, if that's a word, an issue? And if it is an issue, how can we perhaps stop perpetuation of that, particularly sort of amongst our children?
Yeah. I'll touch on the second point first. I don't know the answers to that. It's really, really difficult, basically. But yes, the first bit, like a lot of trans people, they feel like, oh, well, I'm not trans enough. And, you know, gender is a spectrum. And so just because someone wants to transition, I mean, not for me, I'd say I'm 100% male, but you do get trans men that want to wear makeup sometimes, or, you know, trans women that might want to do, you know, more masculine things. And sometimes, you know, I hear it a lot where they feel like they can't because of what other people will think. You know, well, you say you're a man, but you're actually now acting like a woman. And so, yeah, and that's, like you say, that's just societal and a social construct. So, yeah, that is something to be considered, well thought of, to think of a question like that. That's brilliant. What do you do about it? I don't know. Have these discussions like we're having now, I think. You know, I so wish I could get everyone in the world to listen to either myself or a similar story, because, you know, I find even people that are really hot on the D&I and understanding these things go, wow, I hadn't thought of this, hadn't thought of that. And I think it's hearing these things that just allows people to understand that actually we're just human and we just need to be allowed to do whatever we want to do, wherever that is. But society has a lot to answer for. But yeah, I don't know the answers other than what I'm trying to do now, which, again, is a little frog because it's picking away at things, isn't it? Can't change the world, but I can change pockets of it.
Hi, I just wanted to say, incredible presentation.
Thank you.
I'm from the LGBT community as well. Yeah, represent. I love the analogy of little frogs. I think that's really good.
Yeah.
A good way to kind of remember small ways you can demonstrate that you're an ally. I've got one comment about, you asked about presenting in schools. There's a charity called Just Like Us, which I was involved in about 5 years ago, and at that point in time they were definitely doing presentations in schools, but they're young people who are presenting because they want to be more like sort of relatable to the school-aged kids. So I think they still do. Well, yeah, I mean, when I turned 25, I wasn't able to be involved anymore, so.
Oh, wow, I'm nearly double that, so.
But it is a good charity, so if you're wanting to try and get someone to go into school, then that could be an option.
Thank you for that, yeah.
I was wondering if you had any ideas of interesting books or TV shows or films or something that people could go away from today and go and watch a movie tonight that might enlighten them to the kind of experience of a transgender person or non-binary person.
Oh wow! I'm gonna put something up, but your question is slightly off that. I can't think of anything to enlighten on the actual ideas and stuff like that, other than maybe, you know, what I did before coming into transition was I was watching trans people document their transition online. So you get the sort of videos where they're just starting hormones. So I was obviously watching the trans men, female to male mostly. So you get someone, you know, really high pitched voice going, "This is my voice one day on T," and it goes, and gets lower and lower as time goes on. So you watch stuff like that and changes, and they show their chest surgery. So if you want an insight into what it's like and you know how frustrating it is to be waiting, because one thing, you know, again, to do with psychological stuff, you don't realise how, at a vulnerable age, in your early, late teens, early 20s, you're meant to be finding your way in life, from careers to what groups of peers you fit in with and stuff like that. And transition is all-consuming, and then it can take 10 years to transition, and your life's on hold. And so just getting an idea into stuff like that is a really important thing. But in terms of things to watch and books to read, I've actually got a couple, if I can. I've got a lot of blank one here. This is one of my favourite ones. So this is an endocrinologist called Norman Spack. So that's S-P-A-C-K if you want to look him up. And he's got a TED talk. It's like 16 minutes, 41 seconds, so it's not very long. And this is one of my favourite things, because this is what I'm most passionate about, which is about hormone blockers and stuff like that. And basically what he's explaining is, he does it much better than me, but basically there's lots of people, it's very easy to put fear into people. Oh, your children are going to transition, and then, at a young age, they're going to be too young, they don't know what they want, it might be a phase, and they're going to harm themselves, which is obviously, that's really scary for a parent. But what he explains is that, kids can go through phases of cross-dress and play and clothing and stuff like that. But by the time they reach puberty, they've grown out of it, is what he explains. And there's nothing physically you could do until you get to puberty. You can change your name and identity and clothing, which does no harm, completely reversible. So, there's no harm in letting people transition. And to me, what does do harm is letting people go through the wrong puberty, because I wouldn't have scars on my chest. I'd be a bit taller, I'd have bigger hands, etc., etc. There's lots of things at issue with my voice, stuff like that. And for trans women in particular, if they grow to be 6'5" and have big, huge trucker hands, that's not reversible. The voice doesn't unbreak, etc., etc. So, I think a lot more harm is done for fear of doing harm. So, I just think watch that, because he just describes it really, really well. And then beyond that, here's a list. So you've got, for children, in fact, that first book there, Julian is a Mermaid, that's a brilliant one. So it's like, child-friendly language. So that's a really good one. I've read the Chaz Bono book, that was quite a while ago. And then there's organisations online. Gyres has got a lot of information on it about transition. So, but in terms of, I don't actually watch that much in the media, the programmes and stuff like that. So I don't know, but hopefully that kind of answers your question a little bit.
Yeah, thank you.
I've gone off on a tangent a little bit, but it's close to my heart, the blocker thing.
Any other questions? Shona.
Thank you, Matt. I'd like to say it was a really, really valuable talk, and appreciate how open you are. And I've done some reading, but I find the internet quite a difficult place to do that, because debate can get quite
Tell me about it.
polarised. I suppose my question is, when we're at work trying to create a culture and environment where people can bring their whole selves to work, you talked about your kickboxing class and whether you're out. How do you make that decision about whether whether that's part of your identity rather than all of it? And that judgment.
It's hard. It's really, really hard, and I still struggle with that today. I feel I'm in a really good place, because there's benefits and downsides of being out or being not out, etc. And I have a little bit of both, but obviously neither of those is perfect. So it's really difficult, but the biggest thing is you can't take it back. So once I've told someone, I can't change my mind. And in fact, the majority of people around me know, because they either knew me before or something's come up and I think, I'll tell them. But there's just a little part of me, like I said, I think it's probably going back to when I was younger and just wanting to be male and not have anyone know, and almost, a bit of transphobia from myself, internalized, that I don't want to be known as a trans man. So and there's a little bit that quite likes that they don't know anything about the background I've been through. But on the other hand, when I do tell someone, what I find, and this is really heartwarming, is that it doesn't change the relationship at all. If anything, it makes it stronger, because people get me a little bit more, and they've got a lot of respect for the difficulties that I've had. They didn't know that before, so they have a more of an understanding of my life and stuff like that. And then I think, why don't I tell more people? But then I just want to hold on to a little bit. So I'm always tussling with, do I tell, don't I, do I, don't I? And I was saying earlier, Ellison's actually my middle name for that reason, because if not, I also teach guitar and stuff like that, and I do my martial arts. I've taught both of them. And if someone looks up Matt Guitar, and then they find my speaking site. But and I don't mind people knowing. I'm not ashamed. I'm proud of it. You know, I don't not disclose it because I'm ashamed at all. But I feel, especially for people that I see every day, it's one thing. You guys I don't know. I want to be in control of who knows and who doesn't. I want to know who knows. If they found me online, I don't know that person knows, and I want to make the decision if I do tell them when and how, etc. So that's why I kind of do that. So it's a really, really tough one. But as I've gone through life, I kind of think I've got the balance of the best of both, really, which is nice. But it's not easy. He wants to join in.
Any other questions? I think they do. I just want to say, Matt, thank you so much for sharing. Today your presentation is just completely inspirational. So can I ask everyone to put their hands together for Matt? Okay, so that brings us to the end of the day. I'm looking at Stuart thinking, is there anything you are going to remind me that I need to say to people? No? It's been an absolutely great day, actually. Stuart and I and the team have been looking forward to this for quite a while, being able to kind of celebrate 1 year on of the Regional Finance Academy. So can I just thank everybody in the room for kind of coming today, anybody that's been listening or watching online as well. It's just been a really great day. I'm pleased to hear Steve say earlier that we might have another slot on the CFOs next time, which is great. Because we want to keep pushing everything that's going on. But if anybody who wants to be involved, who isn't already involved, please just contact one of us, and we are more than happy for you to join the work that we're doing. So just last thing for me is to say have a great weekend, and thank you for coming.